and participants from India and across the world. Wish you all a very good morning, good afternoon, and a very good evening. On behalf of the Council of Scientific and Industrial Research, I welcome you all to our science session named CSIR India, an innovation hub for global sustainable development. CSIR has been contributing significantly to the industrial, societal, and economic growth of India for 8 decades now. It has helped the country overcome many challenges and crises. CSIR has been immensely contributing to the UN Sustainable Development Goals. Today, the session CSIR India, an innovation hub for global sustainable development, will briefly showcase our S&T interventions and solutions contributing to the UN SDGs. The two-day event would encompass 5 topical sessions and a panel discussion. The day 1, which is today, will start with a brief overview of CSIR by Dr. N. Kalai-Selvi, Director General of CSIR. The first woman Director General of CSIR is also the Secretary to the Government of India, Department of Scientific and Industrial Research. This will be followed by the scientific session moderated by Dr. Ram Vishwakarma, distinguished scientist of CSIR. Today, 7 presentations by our most eminent experts will be made in 3 topical sessions, and these are food and nutrition and botanical innovations, water and life below water, and affordable healthcare. There will be about 10 minutes discussion and Q&A break after every topical session. The day 2 event is scheduled on 28th of September at 4:30 p.m. IST, exactly like today. The scientific session will be moderated by Dr. Sudha Sattva Basu, Director of CSIR Institute of Minerals and Materials Technology. It will showcase our effort through 5 presentations by our distinguished speakers, and the topics covered would be sustainability, focused on energy, environment, cities, and communities. And the other topic would be industry and infrastructure, with a focus on materials for global society. The meeting will conclude with a panel discussion moderated by Dr. K.J. Sriram, Director, CSIR Central Leather Research Institute, which would summarize the discussions and deliberate on the future priorities and significance of international collaborations for global sustainable development. The event aims to acquaint the global S&T fraternity with some technology strengths of CSIR, its technology-based solutions, and their applications for societal welfare, as also to foster global collaborations. We are certain that this informative and interactive meeting will be immensely useful for the global scientific community, startups, industry, policymakers, global think tanks, and other stakeholders working towards global sustainable development. With this brief introduction, I once again welcome you all to our event and request our Director General, Dr. Kalai-Selvi, to deliver an overview of CSIR. Over to you, ma'am.
Yeah, thanks, Rama. Again, pleasant morning, good afternoon, and pleasant evening to all the participants. You can upload the slide. So I'm here on behalf of CSIR just to showcase the overview of various activities that are going on in CSIR, covering the science and technology. Just make it full screen. So today I'll be just sharing my views, especially in this particular angle, that how CSIR, by doing service to the nation, is going to upgrade itself or transform its services in the way that CSIR for globalization. So as many of you are aware, CSIR is having 37 national research laboratories, which are found around 26 cities of this country. And we from CSIR, apart from doing R&D, we are offering courses with respect to UG, PG, and PhD also. Next slide. So as I already told you, CSIR is able to touch upon the various aspects and requirements of the country. One is we are touching upon the industrial requirements. So this slide gives you an overview of what are the different industrial sectors which are being addressed by the CSIR driven R&D. Next slide. So this is again another set of Indian industries like mining, food processing, agriculture, rural cottage industries, and infrastructure. Next slide. Of course, CSIR is doing a lot of intervention with respect to urban related technology requirements also. So you can see starting from the coal gasifier and also for rural as well as urban road making, then the steel slag roads, wherein we have recently demonstrated our technology, and the Hansa NG is the next generation aircraft. So you can see the EV operated car also. There is a fuel cell operated car, and the DME fuel, top one, fuel pilot plant also, and biojet fuel. I think all of you are aware that we are now signing up MOU with different aircraft agencies. Today, we have signed an MOU with even Indian Airlines also. So this is the way in which CSIR is really offering its service for urban related requirements. And this is with respect to how we are able to meet out the rural requirements. So starting from the lavender cultivation, floriculture mission, lemongrass. One interesting story is till last year, actually, India was importing lemongrass. But last year, with the kind of intervention of CSIR, we could export 600 tons of lemongrass oil from India and seaweed cultivation. And similarly, the Anna, a kind of a special apple that also found a special place in our Honorable Prime Minister's Man Ki Baat. Next slide, please. And apart from this rural, urban and industry, yes, CSIR keeps on inspiring the very young talents. So this program is called Jigyasa. This ensures the connect between scientists and the students. Next slide. So apart from this, yes, CSIR is doing a very great role in capacity building, especially S&T human resources capacity building, wherein starting from PhD scholars up to emeritus scientists, almost at every age group, this capacity building is happening through different schemes of CSIR. And you can see at the bottom two very important awards. One is CSIR Young Scientist Award, which is very, very unique and which is having a very great meritorious thing within CSIR family. The other one is CSIR Botanical Fellowship, which is normally called as Indian Nobel Prize. So that is the height of this CSIR Botanical Fellowship. So this is how capacity building is taken care. And of course, if you ask me what CSIR is really doing as on date with respect to different themes or focus areas, yes, CSIR is offering its S&T related services under 8 thematic areas. So one is aerospace, electronics, instrumentation and strategic. Second one is ecology, environment, earth and ocean sciences. Third one is energy and energy devices. Fourth one is on chemicals, including petrochemicals and leather. Fifth one is agri, nutritech, nutrition and biotech. Sixth one is healthcare. And seventh one is, we call it as 4M, mining, minerals, metals and materials. And the last one is on civil infrastructure and engineering, which is very, very important. Next slide. So this is an overview that through all these 8 thematic approaches, what are the different national missions and schemes we are able to cover up? And how do we find ourselves relevant with respect to the various sustainable development goals of this country? Of the 17 sustainable development goals of the government of India, through our various programs, I'm sure we are able to touch upon and do some justice to a minimum of 10 to 12 sustainable development goals. Next. So from now onwards, I will just make you understand in the thematic way how we are finding our relevance with respect to national interest and in the global arena also. So if you just take the first theme of aerospace, electronics, instrumentation and strategic sector, so we are able to do justice with respect to a minimum of 4 national mission programs like this Atmanirbhar Bharat or Smart City or Udaan program. And at the same time, these programs, all the activities are finding their relevance with respect to a minimum of 4 sustainable development goals. Next slide. So this is one good example. As I already told, Hansa NG is a 2-seater, affordable, low-wing aircraft. And this initial certification also we have already completed. And this is going to make a big difference with respect to the training as well as sport and hobby flying. Similarly, if you take the case of multi-copter drones, yes, we have offered our service to some farmers also for fertilizer spraying. And during COVID time, this particular multi-copters, they did a wonderful job with respect to the medicines for their door delivery. Next slide. So next one is the second theme is ecology, environment, earth and ocean sciences. We call it as E3OW. So a minimum of 5 schemes of national interest is getting covered, and a minimum of another 5 sustainable development goals are finding their relevance. Next slide. So here actually we are having twin interests, I would say. One is water mapping, the other one is water management. So high resolution aquifer mapping and management in arid zones of northwestern India is already taken care. We have completed phase 1 and we are now very much doing playing an active role with respect to phase 2. And we are coming up with a smart water management system, including IoT based systems. And of course, as an extended arm, we are now developing technologies in the directions of early warning system also, so that we will be able to alert the country well in advance. Next slide. So the third one is E2D, we call it as energy and energy devices. A minimum of 3 missions or schemes of the country, as well as a minimum of 3 SDGs are getting covered through this particular theme. Next slide. So here what you see is, I'm just giving only one example. This is a recently established lithium battery manufacturing facility, which was fully funded by CSIR. And today this particular facility is capable of coming up with 1000 cylindrical cells per day. Next slide. So this theme is CLP. We call it as chemicals, including leather and petrochemicals. And as most of you know, today, whatever the India is having as Indian leather technology, it is CSIR's leather technology only. We can proudly say that. So we have 3 national interests and 4 SDGs, which are getting their coverage under this one. And to name a few, I have given azelaic acid and isobutylene related derivatives here. And of course, now we are coming up in a big way with respect to different other chemicals also for their great manufacturing and further inputs. Next slide. So the next theme is agriculture, nutrition and biotech. Here we are having a wide coverage with respect to our national interest. A minimum of 8 schemes are getting covered with respect to national level. And of course, we are touching upon 4 sustainable development goals also. Next slide. So in this case, as I already mentioned in the Honorable Prime Minister's Mann Ki Baat, we found a place through this particular event. And especially in Northeast Asia, we are coming up with the kind of a special variety of an apple, wherein originally it was requiring a chilling time of more than 1,000 hours, but now it has been reduced to the tune of 400 hours. That is the beauty of CSIR's intervention. Coming to healthcare, here also we are having a wide coverage. Again, 8 national schemes are getting coverage and 4 sustainable development goals are getting covered under this particular healthcare theme. And in this case, actually, we are developing one mRNA platform by means of which we can make that platform applicable to meet out the requirements of the upcoming pandemics or any kind of health related threats. So this is one beauty, and added to that, we have developed some kind of a testing services which are made accessible and are affordable also. Next slide. So this is a 4M theme. A minimum of 5 national interests and a minimum of 7 sustainable development goals are getting covered under this 4M theme. Next slide. So here we are able to extract metal values both from the primary as well as from the secondary resources. Here I have given waste to wealth as one good example. All types of metals, starting from light metals, transition metal and rare earth metals, we are doing extraction both from the primary as well as secondary resources. Next slide. So this is civil infrastructure and engineering. Here again, we have a wide coverage of a minimum of 7 national interests and 5 SDGs. Next slide. So this is India's first steel slag road. Actually, 3 important factors are there associated with this one. One can reduce the thickness of the conventional road thickness by about 30 to 40%. One can reduce the cost also to the tune of 30%. Then if you ask me what is the service life, a minimum of 30 years is really assured now. So with these kind of 3 very important and attractive features, now we are going to expand it in a big way in the country. We started proving this particular technology in the Mumbai-Vadodara Expressway, but we are planning to extend it to other places. To start with, we will go ahead with Arunachal Pradesh with immediate effect. So this is one good portal. This gives the overall view of what are our technologies, what are the various laboratories, who are all the scientists, and how many students are getting really benefited out of all these CSIR technologies. All these informations could be really obtained from this particular one portal. So now coming to the last part is CSIR. We have already prepared our vision 2030 because country is now moving ahead 2047. After we completed our celebration of 75 years of independence, now we are getting ourselves geared up for 100 years of India's independence in the year 2047. Country has come up with a national vision for 2047. Of course, CSIR also is very much in alignment with the national vision 2047, for which the first step is CSIR has come up with a vision document on 2030, which is very much in line with the UN Sustainable Development Goals. Thank you very much. Like each and every one of you, I'm also excited to listen to the proceedings of the whole day. Thank you one and all.
Thank you, ma'am, for this wonderful overview of CSIR. Very wonderfully, you have covered this broad overview and connected it with the deliverables nationally and what we can do internationally. Thank you, ma'am, once again. And now we move to our scientific sessions. May I request Dr. Ram Vishwakarma to please take the floor. Dr. Ram Vishwakarma is our moderator for the next session, the scientific session.
Thank you, Dr. Rama. Can you hear me?
Yes, sir.
Yeah. So good morning to people who are joining from New York or other places, and good evening to people joining from India. It's my pleasant duty to welcome you all for this very special session on Science Summit as a part of the ambit of Science Summit at the 77th UN General Assembly, and a special session on CSIR, an innovation hub for global sustainability development. It's my pleasant duty to welcome you on behalf of the Director General of CSIR, Dr. Kalai Sadhvi, who just spoke about CSIR, and entire CSIR scientific community and the people who are going to speak in this session. As Dr. Rama mentioned earlier, that there in this particular special session, there will be 3 sections. Just to repeat, the first section has 2 speakers, which is focused on food, nutrition, and botanical interventions. Second session is affordable healthcare. There are 2 eminent speakers. Session 3, which is on water and life below water, as aligned with the CSG 17 of CSG, and that has 3 presentations. And people who are going to present they are all leaders of Indian science. They are all directors of national laboratories of CSIR, Council of Scientific and Industrial Research, and they represent very large scientific expertise, scientific infrastructure, and track record of delivery nationally and globally. So I think this is one set of assembly of top-line leadership of India as well as CSIR, which is going to speak to this session. So I will go for the session 1, and like Dr. Rama said, that after every section there will be a Q&A, and I will request that people who have a question, they can put on chat box on Zoom or other platform, and my colleague Mohit will take care of those questions from the other platform, and if I can read on the Zoom, I myself will raise your question to speakers and so on. So first session is food and nutrition and botanical innovations. There are 2 speakers, so I will first invite our first speaker, which is Dr. Sridevi Annapurna Singh. She is Director of Central Food and Technology Research Institute of India. This is one of the oldest food research institution, I can say, in the whole world, and goes back right into, when the realization of, if you remember the Dr. Gopalan's work, those who are in nutrition area, which happened in India, ORS and other interventions happened in India, because India faced this problem square on of the nutrition from the very beginning because of the disease burden, because of the food scarcity. And I think this glorious institute contributed greatly to our security in nutrition and food security. So I think it's my pleasure to invite director of that institute, Dr. Sridevi Annapurna Singh, and I think she will tell you about the innovations and interventions that are happening in India, which are relevant to Sustainable Development Goal of United Nations. And I think we are looking forward to her presentation. Dr. Singh.
Namaskar. respected DG CSIR, Dr. Kalai Selvi, and the entire CSIR family who is with us today. My greetings to all the dignitaries and the participants of today's summit. I will be presenting CSIR India's innovations for sustainable development in the area of food and nutrition. So, needless to say, we all know that a large population is dependent on agriculture and food production. In India itself, there are around 41.5% people who are depending on this for a livelihood. And a lot of food is unfortunately wasted, though it is produced. Nearly 30% is wasted. And in addressing this, a lot of climate change as well as greenhouse gases are emitted, and there is soil depletion. A lot of forests are cleared for this purpose. And because of, but on the other hand, we see that there is a large population who is undernourished, as well as in urban areas, many developed countries, we are seeing obesity and metabolic syndrome and the advanced risk of lifestyle-related diseases. Globally also, we see around 1.6 billion people who are anemic, especially women and children. So all of this needs to be kept in mind, and therefore, although food is very essential, we need to look for solutions not only for treating undernourishment or overnutrition and anemia, but also climate change. When we come to India, we are a huge country. We have a huge population, and nearly 40%, slightly higher than that, is dependent on farming. In that, 85% are small and marginal farmers. We have a very big group, nearly 67%, who are in the earning group of 15 to 64 age group. And when we look at food production also, we find that India is very fortunate that we have 20 agroclimatic zones, and 20% of the GDP comes from agriculture. Unfortunately, though we are self-sufficient, there is a huge population of 200 million people who are hungry. And on the other side too, we have overnutrition, which has resulted with a diabetic population and cardiovascular disease, cancer, and so on. Now, although we are in the first top 3 producers in food, we find that processing is very limited. In some sectors like fruit and vegetables, only 2 to 8% is processed, whereas in dairy, we find that around 35% of the food is processed. Therefore, the farmer is not getting that much of income, because export is primarily processed foods only. And this means that there is not much of value addition. Having said that, the food processing industry in India is really growing by leaps and bounds, with an annual growth rate of upward of 12%. And in the food, grocery and food services, it's around 25%, and it is estimated to reach around $500 billion. Now, many of the labs, like our DG said, we are situated all over the country, but many of them do touch food, especially in some way or the other. And these are listed over here, which are in all parts of the country. So if you look at the networking of the labs and the contribution, we find, especially in product development, which has been a core interest, we have around 450 plus technologies that have been licensed to more than 4,500 industry partners. This is especially in the region of nutritious supplements. We also have done a lot of impact studies, and especially in natural disasters, we do provide food. And the CSIR labs have worked on all the produce, agri-produce, be it cereals, pulses, oilseeds, underutilized grains, and so on, to really understand how they can be used in as food. And there are many grains which are very indigenous to our country, and therefore it is imperative that we should work on that. Apart from technology development, we also do a lot of training, and this ranges from students to farmers to industry, and especially women. We offer engineering services in the area of food. It could be machine design for some of the indigenous grains, It could be scale up of the processes. Many times we hire out our pilot scale machine so that entrepreneur need not have to buy it and need not have to invest unless he is very certain that it works. We prepare project reports, and we also use green technologies and integrated processes to address climate change. We are very much into testing. It could be for the regulatory authorities, it could be for export, it could be for the imported materials that are coming into the country. We often also assist to the Codex and FSSAI. We participate in proficiency testing both nationally as well as internationally. We are certified by the regulatory body of India, FSSAI. Many of the animal laboratories do have GLP, and NABL, which is an accreditation board for laboratories, and ISO and EMS. Coming to the sustainable goals, I would be restricted to 2, 3, 5, 8, 9, and 13. And of course, all of this put together will result in partnerships for these goals. But almost 11 to 12 do help in food and nutrition of the sustainable development goals. Coming to zero hunger, CSIR has done a lot of impact studies in the states of West Bengal, Odisha, as well as Karnataka. And these are recent studies. What I'm saying, it is only a bird's eye view. We are doing a lot of help for the government intervention programs also. It could be in the form of product development. It could be in the form of understanding how to optimize the processes and how to train people in producing hygienically and so on. And the last plan period of 2012 to 17, we also developed an array of breakfast foods, keeping in mind the cultural preferences of different parts of India, which can be used for children. One intervention program is what I'm highlighting over here. Before intervention, we found that the children had anemia, low vitamin A, low anthropometric parameters. Just within 6 months, we found that we could make a significant difference in the anemia profile of these children, and especially the stored ferritin levels were normal after the intervention, but in the control group it was not so. So this particular study involved around 270 children, and we gave 7 products of CSIR to these children for a period of 6 months, and they were in the age group of 3 to 7. So this is a success story which I would like to highlight. There are many such. The new energy food was used by the government of India in the intervention programs. Just in the state of Karnataka alone, 36,000 tons per year were produced, which means that our technologies can be very well scaled up. If you look at the scientific intervention also, we made sure that the starch, which holds a lot of water, would be broken down by enzymes, and therefore the nutrient density of the food can be increased. And this is important when a small child has a limited appetite. And this particular technology has also been transferred to more than 20 entrepreneurs. Another technology is the fortification of atta. Today, more than 1 crore population are getting the benefit of this technology. It has been used extensively in Himachal Pradesh, in the midday meal programs also, and public distribution systems. And it has been transferred. It is micronutrients are added to the flour in a continuous process. Fortified salt, anemia is a big problem. Like I said, 1.6 billion in the world have it, and iron and iodine double fortified salt has been developed, and this is now currently underwaiting the clearance from FSSAI, which is the regulatory body. In disaster relief also, it could be earthquakes or floods or tsunamis. We have ready-to-eat nutrient-dense foods that are either easily reconstitutable at the site or consumed immediately. All of these have long shelf life, and therefore they are very handy in such disasters. We are looking at alternate sources of nutrition for menu diversity and as protein sources. We are looking at seaweeds. We are looking at algae. All of this, India has a very big coastline, and they have been underutilized. Coming to health and well-being, which is SDG 3, we have a large number of products in our kitty. They could be low glycemic index foods, we have low sugar foods, we have gluten-free products, we have foods that are specifically targeted towards sports persons, maybe the geriatric population, people with metabolic disorders. And today the gut health is known to be very, very important. And we have also developed probiotic foods as well as prebiotic foods. We have a large number of multigrain products and traditional foods without additives too. Spirulina is another underutilized blue-green algae, which is edible. And we have come up with a large number of technologies wherein the micronutrients as well as protein content of the food can be increased, especially in traditional foods, which are well-liked and accepted by the Indian population. Gender equality, CSIR has always held it very high, and we have in the area of food and nutrition trained a large number of women and self-help groups from villages and small towns, so that even if they are not very highly educated, they can still become entrepreneurs and they can start preparing various products and market it under their own label. So these are some, even in the Northeast India, we have done these studies and we have trained people. Today, a few of them are earning up to 30,000 and 3,000 rupees per day with the training that they have received from our organization. We have also tried to train other entrepreneurs so that they can also find a livelihood, especially in the aspirational districts where we have tried to generate jobs for people, and they don't have to really leave the place and migrate elsewhere. So this is a summary of all the kind of interventions that CSIR has done. We have linked up with many organizations in this process and we are working with them so that we can make a difference. It could be that we are providing them knowledge, we are giving them counseling, or we are giving them technologies. We handhold them till they are independently confident of running this one. UNDP had supported this program wherein dals are consumed in India specifically. So the pulses that are harvested do not get as much as of a price as value-added dals. So a small versatile dal mill has been developed, which the farmer himself can operate and get value addition to his product. And under the UNDP program, we were able to put up 200 units across the country, and even our licenses have sold more than 5,000 units. And it is versatile because it can be used for either pigeon pea or chickpea and other kinds of peas. We have tried to develop entrepreneurship in the area of food processing. We offer food free technologies on our websites. We train people so that they become more confident. We link them with funding agencies. We develop their skills. In this process, we have also conducted farmer-centric training, and over 800 such people were trained in the last year itself. We also do a lot of certificate courses and master's courses. One such is the International School of Milling Technology, which is there in Mysore at the CFTRI. And currently around 600 participants have been trained, of which 100 are foreign participants from various countries of Asia as well as Africa. And these students, after training, go back to their countries and they either train others or they themselves are setting up plants and they are able to market it within their country and even go for exports. So our master's program was also originally, it was affiliated to the United Nations University, and after 74 it was affiliated to the University of Mysore. Many of our students are key positions they are holding in the food industry globally. And apart from this, we also have a large number number of PhD students on all over the CSIR labs who are now taking up entrepreneurship in food also. Coming to climate action, food is one of the major contributors, and therefore we are trying to develop alternate processing technologies as well as use enzymes which are considered natural and very good. And we have a lot of capabilities like downstream processing, basic enzymology, and so on. And many industrially important enzymes which are food grade have been developed. And these are also being used for food applications. 2023 is the International Year of Millets. It has been declared by the UN on the recommendation of the Government of India. CSIR has done extensive work and developed a large number of technologies in this area, including not only the products, even the primary, secondary, and tertiary processing has been optimized, as well as the prototypes for machinery for processing these grains have been worked on. We have more than 40 technologies in this area. We are now looking at how to increase the shelf life so that they will find a global market. We also have a mobile processing unit for especially fruit and vegetable processing. Like I said, 85% of our farmers are small farmers, and therefore it is difficult for them to bring their produce to the marketplace or to process it themselves. But for value addition, this particular unit can go from farm to farm and help the farmers. Thereby, it is reducing the wastage also. The important thing is that the equipment which is housed inside this vehicle can also be changed to suit regional needs. It can also be used for training people in their own place. So we have customers from very small to medium enterprises to large multinationals who have taken these technologies and who have partnered with us or who have sponsored certain projects with us. So based on the way the food and nutrition perceptions of the consumer are changing, we are also adapting, and we are trying to develop healthy and convenient foods, guilt-free foods, which are actually substituting plants, animal foods with plants. We are looking at minimal processing so that they are safer and more nutrition dense. And therefore, for all these activities, we do require a platform for discussing the challenges, building strategies, exchanging ideas, generation of employment, skill enhancement, and improving as well as expansion of business. And this, we would like to do it on a global scale. What I have presented is only a bird's view of our capabilities and interests. And like our DG has already mentioned, many of these sustainable development goals also are very similar to our national goals like Anemia Mukt Bharat, Startup India, Skill India, import substitution, and so on. Thank you very much for your attention.
Thank you, Dr. Singh. I will now move on to next speaker. Next presentation is by Dr. Saroj Parekh, a leading plant biologist of the country, who keeps one foot in plant biology and one foot in translating that knowledge to society. So he's going to talk about botanical intervention and innovations and how they are addressing the need of nutrition, food, and also therapeutic getting ideas from traditional system of medicine of India. Dr. Parekh.
Am I audible?
Unmute, Dr. Parekh.
I have done it. Am I audible now?
Yes, sir, you are. Yes, sir, you are.
Thank you. Respected DG, Coordinator, Dr. Ram Vishwakarma, and my all colleagues and the esteemed audience. Well, just now my colleague Dr. Sridevi talked about food and nutritional security, and now I'm going to talk something related to the 3 SDGs: no poverty, zero hunger, and of course the SDG 13, that is how we are getting prepared for the climate action, particularly in the agriculture sector. So my title is Botanical Innovations. Well, there are CSIR is in the forefront of cutting edge technology in the agriculture sector or in the plant science sector. We have technology in many areas, including the development of. We have technology in many areas, including the development of. We have technology in many areas, including the development of. Today, I have technology in many areas, including the development of. Today, I have technology in many areas. Disease I am targeting. CSR has expertise in the crop improvement, and we have the infrastructure using conventional and molecular breeding, for also mutagenesis using gamma radiation, genome editing, and transgenic approaches. We have the field taxonomy strength, very rare in the Indian context, with a large network of CSIR herbaria, and that adds to the bioprospection for novel species, genes, and biomolecules. Our scientists go to the wild areas yet to be explored, and we identify novel species, new genes, and new biomolecules, which are subsequently utilized not only in the agriculture sector, but also in the healthcare sector and other human welfare sector. Cutting-edge R&D achievements in biotic and abiotic stress management of diverse crops through genetic manipulation and plant growth promoters, whether it is microbial origin or it is the green molecules. And of course, at times we do the genetic manipulation to really make our plants or crops adapted to the biotic and abiotic stresses or to fight with those stresses. Specific metabolite targeted crop improvement in medicinal plants, as we know that active compounds are there, we need to enhance those productivity of those metabolites. So we have targeted metabolite crop improvement programs are there in medicinal plants. We have also microbial and seaweed-based biostimulants, biofertilizers, and biocontrol agents. So these are some of the strengths in the agriculture sector, which I would like to give you some examples. It's not possible because almost 32 institutions of the CSIR labs have been working in these areas. So I will just give a few examples of that. Two of the most important crops, I think, that is the India stands second in the production of rice, because rice is the staple food. And as you, all of you are aware, that a substantial amount of rice requirement globally is met from the South Asia. And India, with 129 million metric tons per annum production, only after China. So we are the second largest producer, and we are the largest exporter of rice in the world. Similarly, the second crop I will talk about the cotton. Even though India's production, recently it has gone down to second position, we had a first position for decades, and with 6.2 million tons, now that is the production capacity of India, only little less than China, which is 6.4 million tons during the last 2 years, but it is possible India will make a reappearance at the top of the list. And unfortunately, we rank only 37th in the cotton productivity. Although our area is big, a large area is under cotton cultivation, but unfortunately the productivity is poor. So that is the matter of concern, and our CSIR's target, CSIR's research has been oriented towards improving the productivity, not only in terms of the yield, but also to reduce the biotic and abiotic stresses so that productivity can be enhanced. It is due to rainfed irrigation or insect pests. So this is the challenge which we are trying to address. As I said, whether it is the chickpea, a variety of crops, we do that research and development activities, but I will be confining today to rice and cotton, and of course a few more futuristic commercial crops. Say for example, this is bacterial bite, a serious disease of rice. You can see that the disease symptom is there here, and Xanthomonas oryza is the causal agent. And you'll find there is no chemicals which can control this bacterial blight. So you will see this dried part of the cultivation. And we have, on the other hand, a Samba Masuri, a traditional variety, and it is a leading rice variety of India, grown more than 4 million hectares now. It has exceptional quality and yield characteristics, up to 5 tons per hectare is the productivity. So this is, but unfortunately, this so good variety of rice is susceptible to several pests, including bacterial blight. So our lab, CCMB, Samba Masuri, fine quality, high yield, but it is susceptible to BB. So with the poor quality 3 BB resistance genes, XA21, XA13, and XA5, this is the marker-assisted selection. The improved Samba Masuri, the hybrid developed is the fine quality, high yield variety. That is the BB resistant. And you can see here that here is the example. Here you can see that is completely free from the BB. And here you can see that it has been released for commercial cultivation. It is now being cultivated more than 9 lakh hectares in at least 7 states of the country. And total value of ISM produce is estimated to be 8,650 crore, huge amount. So the subsequent to that also we have the DRR Dhan 58, which is resistant to, in addition to the BB, also salinity tolerance, and also low soil phosphorus tolerance, and also resistant to blast disease also. So these types of Samba Masuri varieties have been developed using the molecular breeding approach, and you can see the examples and also the impact, social impact. Now we'll come to the another area where you will find that CSIR institutes, they deploy the most advanced technology depending upon the nation's regulatory, within the nation, conforming to the nation's regulatory framework. Recently, the country has allowed site-directed nuclease 1 and site-directed nuclease 2 categories of genome editing. So those genome edited plants will not be treated as transgenics, but they will be allowed for cultivation by the farmers with minimum regulations. So you will see that now CSIR labs are ready. You can see here the tomato early ripening or flavonoid rich, or even the fruit variation of faster fruit growth, and also the delayed ripening, softening for higher shelf life. Or it could be the whole plant growth manipulation and with the targeting a particular gene. So you can see the CRISPR lines are ready. And here also the root manipulation with the CRISPR editing, you can see that drought tolerance has been developed. Similarly, we'll see that we have also the cotton where the cell pruning, that is the SP gene and the SFT single power transgenes have been edited, and the generations, and some of them are second, third, or fourth generations plants are ready now. You can see that here another one, that is the arsenic is a problem in several parts of our country, at least 11 states, even worldwide also. If you see our neighbor Bangladesh is also a big problem. So to address that issue, we have a variety already released nationally, that is from NBRI, but also we have a variety which is developed through the genome editing now, and you can see that by editing that transporter genes, at least 4 of them have been are ready. So this is the arsenic, so that the arsenic doesn't reach the grain. It is either stopped in the root zone, or it is in the, in some cases, it is in the vegetative part. Here I am talking about, after the genome editing, CSIR is in the forefront for cutting edge research, as I said. So this is the, because non-edible crops are allowed in India for their transgenics. So we have CSIR has developed transgenic cotton, and you can see that the first transgenic cotton we developed, that is the using, as I said in the beginning, our scientists go to the wild areas where they bioprospect for the new molecules. So here is an example. You will see Tectaria macrodonta is a wild edible fern, which we found that yes, it is, whitefly doesn't sit on it. And interestingly, the protein was isolated, the TMA12 gene was isolated, and it is completely, when we introgress with that tree, with our cotton, it is completely resistant to the whitefly. You can see the figure here. So Cry1SC, TMA12 cotton, when we 2 gene introgressed cotton we developed, it is free from cotton bollworm and whitefly. So that is good for North India. So similarly, we have a Cry1EC gene. Again, it is CSIR's own gene. So with the 2 genes, Again, Cry1AC and Cry1EC, it is good for Central and South India, taking care of cotton bollworm, pink bollworm, and cotton leafworm. Similarly, 3-gene stacking Cry1AC, Cry1EC, and TMA12. These are all going on, and several events have been tested in close collaboration with our Indian Council of Agricultural Research and some agricultural universities, and this is in their cotton mission. And some of them are in the third generation, fourth generation, and so on and so forth. So transgenic approach to non-edible crops are also going on in a big way. Well, as a futuristic crops, say for example, this is the cannabis, as you know, this is a narcotic plant, but we have a lot of medicinal value to that. And this plant originated from India, Cannabis indica, Cannabis sativus. So what we are trying to do here, we are trying to reduce the psychotropic substance, that is THC content, to less than 0.3, so that it can be cultivated by our farmers. It will not only meet the CBD requirement of the country, but also it will help to enhance the economy of the farmers. So here you will find that genome editing, both the THC synthase gene knocking out, as well as enhancing the CBD synthase genes, so that we get the high medicinal targeted compound, that is the cannabinoids. So this is the approach we are taking, and this is also, at least we have 6 lines which are conforming to the national regulation, or the even at times international also. Several countries, although they have relaxed, but still there. So we have now 0.3% THC and less. Here is another futuristic commercial crop, which of course it is the opium poppy, that is the Papaver somniferum. And you can see the cross, and in the F10 generation we go up to F10 generation, and ultimately we get the from conventional or wild variety 2 to 3% of Thiven. We have got now 10%, 12% Thiven rich varieties. So like that, even we have the morphine, codeine, papaverine, Thiven, the entire that pathway. If you see, now we are working on the, this is the example of how we did it. And here is the oripavin now we are working, where you will see that global demand is 200 to 300 metric ton per year, and India has right climate, right soil, and right variety. So now we are working on the oripavin production, and you can see these are some of the varieties which have been released, which have been commercialized. One multinational farm, Rusan Pharma, also it has been given. And because these are the crops of the future, both the cannabis and the papaver, we would like to collaborate with international organizations and also the industries. Whoever is interested, already the people are there, but also we can customize the other requirements. Here also, as I said in the beginning, agriculture is really drastically affected by the climate change, and particularly developing nations are really victim of that. So we have now, this is the PACE facility, we have developed, we have identified the varieties which are really smart, even if the ozone content is increased, or carbon dioxide is increased, or temperature is enhanced. Then also those varieties we have which can be really resistant to the yield reduction. So we have identified those. Of course, our R&D is concentrating on resistant varieties to these factors as well. So this is the PACE facility which CSIR has, and we have identified for the different ecoregions of the country. Even if climate change comes, we have the varieties which should be propagated. Here is after these R&D activities in the 2 fields, as I showed you, we also reach to the farmers and entrepreneurs, because our target is that we have to enhance the farmers' income, not only 2 times, but we are targeting more than 3 to 4 times. And one of the examples is the Aroma mission, which we started around 5 years back, and now it is the second phase. And you will see that almost throughout the country, both the green and pink, purple color dots, it shows that it is distributed throughout the country. And you see the benefits in the right side. More than 26,700 hectare area has been covered under at least 10 aromatic crops. And of course, the distillation units also for value addition we are deploying. And in all those are with the very active cooperation of the farmers producer organizers of the clusters. And also you will see that essential oil-based value-added products we develop. 29,000, almost 30,000 manpower has been trained to cultivate, to add value to it. And of course, we do not only do with the urban areas or the improved farmers or the big farmers, but also in the tribal cluster areas, tribal clusters and aspirational districts as well. Well, we have here many things have been done, but I will just talk about 3 success stories. One is the mint. Once upon a time in 1970s, we were importing huge quantity of mint oils, and today we are the exporter to Argentina, Brazil, France, Germany, Japan, UK, and USA. And you can see the journey like this. This is the CMAPS varieties starting from the 1985, and it goes up to 2020. You can see that varieties are being developed, and along with that, the income of the farmers are enhancing, because the mint oil yield has been increased in subsequent varieties. So you will see that the net income is 70,000 per hectare, and just in 110 days, the farmers get it. So you will find that in these varieties are really boon to the farmers' economy. The second story is in our disease presentation, it was there. It is the lemongrass, and it is a very, very recent story where we will find that again, we have from the net importer, we have become the exporter. So you will see that 21-22 data in the down, 610 metric tons of lemongrass oil we have exported to the other countries. Now we have the 2 success stories, the purple revolution of the lavender in Jammu and Kashmir. You will see that it was introduced in Doda, Ramban, Kishtawar, Kathua by our lab in Jammu, that is Tripura and Jammu, and you will find more than 1,000 lavender farmers. Because of our CSIR intervention, they have been benefited, and they are earning at least 2 lakh per acre, where the traditional crops were giving only 20,000 rupees per acre. Similarly, in Himachal Pradesh, our IHBT lab, they have been doing wonderfully with the yellow revolution, that is, you say, wild marigold. It is, you can see 6.5 tons per annum production of wild marigold, and farmers earn almost 5 crore rupees per annum by the sale of this oil, and income at least 2.5 times. And now I'll talk about floriculture mission. We started 1 year back. It is in the 2nd year, but you will see that we have covered 1,830.32 hectare. So far we have covered, and every year is the target. And you will see that many varieties are being developed by the CSIR labs, and we have the gamma radiation, and you can see the example, NBRI is 75. This is the variety. Every year, 2-3 varieties we release, and in the national level, we release them, and they are released to the farmers for their economic gain. And you can see the most important thing is here, most of the flowers which in India we cultivate, they are all imported. But because of our rich biodiversity, we have a lot of wild ornamentals, and why not they can be also polarized. Some of the examples you can see here, including you see Bhanda or Dendrobium, or even the Tulipa, the wild relative of tulip. So we have things so we can really make them. We have identified 55 such wild ornamentals, and we have a target to internationalize those beautiful ornamentals. And you can see that we have completely mapped the fragrance depending upon the fragrant compound, whether it's the marigold, jasmine, lotus, roja, tuberose, and based upon that, this map is there, and we are growing the crops accordingly. And it is not that only it is the targeted for the crop variety, but also the targeted compound. And this is the CFTR evaluation we have. Here you can see that freshness keeper, or it is the honeybee boxes. We have 8 verticals under the floriculture mission, and our target is from the present 0.61% only global floriculture market. We would like to capture as much as possible, but certainly given the agroclimatic variations and geographic extent of this country, anytime around the year we can grow any flower. So that is the advantage, and we would like to have the international collaboration, not only in the marketing, but also to market also our value-added products, secondary, tertiary, very high value-added products we are developing under this one. And last slide, that is the at least 8 CSIR labs. They are actively involved in the development of the biostimulants, biofertilizers, and biocontrol agents. And that is a huge market is there. So you will see that this is an example. We have not given the microbial-based biofertilizers or biostimulants or the, you can say, the biocontrol agents, but this is the seaweed-based biostimulant, our Bhavnagar CSIR Bhavnagar lab, where the seaweeds are being utilized. An example is here how they are increasing the plant productivity, but also they have the other applications. But for the example, you can see 25% reduction in use of fertilizers, biotic and abiotic stress tolerance, and improved crop productivity from 11 to 37%, and this technology has captured 10% of Indian biostimulant market. So you will see the impact, at least more than 1,500 crore rupees. That is the increase the farmers' income in 2021 itself. So there are huge opportunities and technologies of CSIR. They are reaching the farmers, not only the R&D development in the forefront of the country, not only country, in global technology. We have some technologies which are competitive in the global scale. At least 14 labs are working actively on the different industrial enzymes. And we are now the CSIR look for the international partnership, collaboration, and many of our technologies have been matured, and we will happy to collaborate, whether in the R&D areas or in the marketing or customizing the requirements of the different stakeholders globally. Thank you so much.
Thank you, Dr. Barik. We have 3 questions on my chat box here. And I think first question is addressed to Dr. Singh. I think question is by Asi, is that what are the key barriers to development of functional foods and nutraceuticals in terms of ecosystem development, scalability, etc.? What has been the experience of CSR in this regard to say the Nimitli initiative or any related initiative? Dr. Annapurna Singh would like to take this question.
Yes. Actually, many of the nutraceuticals are from natural sources, and often it depends on the variety. When you look at the Ayurvedic formulations, it depends even on the soil in which they have grown. So we have not, we need to map the bioactives and to look at their mode of action and to understand whether they are effective either within the matrix or in isolation and so on, which requires a lot of R&D. So currently at the moment, that would be the key problem, I would say.
Thank you. Next question is, welcome Dr. Selvamurthy. I'm happy that you are joining this session. His question is, please let us know about the CSR initiative in the climate resilience in agriculture. I think Dr. Barik can take this question.
Thank you so much.
Thank you, Dr. Selvamurthy. Welcome.
Yeah. Thank you, Dr. Barik.
Yeah.
Thank you, Dr.
Selvamurthy. From your side.
Thank you, Dr. Selvamurthy. The question is, as I showed in my presentation, we have a very big program that how to, number one, the many varieties we have in this country, but we have to screen them which will be climate smart. That is number one. Whether it is the drought or it is the ocean or it is the carbon dioxide or temperature rise. So we are doing already with the pests and the OTC facilities we have in the different labs of the CSIR. That is number one. So that in case of the climate vagaries, our farmers, they do not suffer. Number two, we are developing the varieties which are stress resistant. Say, for example, it is the thermal stress or it is the water stress, so or it is the biotic stress resistant, as I showed you so many. So that, as you know, when the climate changes, the temperature increases, you will find that those insect pests also they increase. So the biotic resistance we have to develop. So that is the second category, new varieties development. Automatically, whatever the varieties are there, we are screening, but also we are developing new varieties. The third thing, because it is most of the areas of the country or in the world, you will find that erratic rainfall will lead to the drought. So how do we deal with that? So in precision agriculture, we have a big program in CSIR, which we are starting, where you will find that precision agriculture also includes the irrigation. So those aspects are also being taken care of. And the most important part is this, for the adaptation, also we are developing several technologies which will be helping the farmers in adapting those type of eventualities. And of course, mitigation the whole world is doing, including the energy and other disciplines they are taking care of. So totally, if you see that CSIR is committed for not only mitigation, but also the adaptation. So they all round, so that our farmers do not face that much of challenges when really already climate change happened. But I am sure with the CSIR technologies, it will be minimized, the impact. Thank you.
Thank you, Dr. Barik. In the interest of the time, I will, because we are running late, I will just take this quick question by Juliet, which came on Twitter. And the question is, thank you for this program today. Glad to know your project. I'm joining from UK, and I want to know more about your projects in Kenya. Who want to take this? And there is a phone number. So I think if we don't have immediate answer, perhaps we can contact Juliet and then have the conversation regarding our project. If you have Dr. Singh or Dr. Barik.
We did start a program in Africa, including Kenya, but it has not gone. We have some industrialists, they contacted us. We have given them several medicinal plant varieties. That was the agreement, but somehow I think it has not progressed much. But yes, we are open to that. Whether it is the medicinal plants or any other sector, we will be happy to give that.
So we will get in touch with. I'm sorry, Assis, I can't take any question because we are running late. I have to move into next subsection, which is on affordable healthcare. And the first presentation will be made by Dr. D. Srinivas Reddy, Director of Indian Institute of Chemical Technology of CSIR, and also Indian Institute of Integrative Medicine of CSIR. Dr. Reddy is a very accomplished organic chemist, medicinal chemist, with a broad range of understanding of healthcare and affordable healthcare. So, Srinivas, over to you.
Sir, can you hear me, sir?
Yes, sir.
Yes, sir. So
Yes, we can.
Srinivas, before you start, may I request, because a lot of other questions have come in chat box, so maybe presenter Dr. Singh or Dr. Barik, they can see, can they respond on chat box to the person concerned, or we can engage them later because their all the coordinates are with us. So I think Dr. Singh and Dr. Barik, can you do that, please?
Yeah, I'll look at it and
okay.
Definitely.
Yeah, go ahead.
Hello, good morning, good evening, depending on where you are. So I'm going to talk about affordable healthcare, particularly on therapeutics in my presentation. Of course, it is aligned with Sustainable Development Goal 3, that is a good health and well-being. So if you look at Indian pharmaceutical industry, so far it has achieved tremendous growth in the past few decades and has been instrumental in supplying generic drugs to the global market. Of course, India fulfills about 20% of the global demand in generic medicines in terms of volume and supplies over 60% of the global demand for various vaccines and also in particularly this antiretroviral ARV drugs. The pharmaceutical industry is indeed sector of pride for India today. Just to tell you, 1 out of 3 pills in United States of America is coming from India. If you analyze some of the statistics, India has touched close to 50 billion and significant portion is exports worth of about close to $19 billion US dollars with a growth of close to 20%. The major contributors are bulk drugs, finished dosage formulations, biologics, and Ayush and herbal surgicals. CSIR has played a significant role in the last few decades in achieving this feat and continuously playing significant role even today. The sector was almost non-existing before 1970. It was mostly dominated by foreign countries. So after the introduction of this revised patent acts in 1970, through the strategic role, played by the public sector that is in India, particularly with the CSIR help, the pharmaceutical industry, particularly generic industry, like a Zoom, it's kind of made significant impact. Between the 1990s, 1970 and 1970 and 90, so we have expanded market and market also expanded into other countries, all operations. In particular, CSIR used this reverse engineering of pharmaceutical products in generic drugs. After 2010, So number of patents filing also increased in various CSIR labs. Many sponsored projects coming from CSIR labs to develop, particularly to develop novel and cost-effective process, and particularly this industry, many industry came to CSIR labs. Over the years, CSIR has developed many capabilities in all segments of pharmaceutical industries. If you look at that chain, pharmaceutical industry value chain, so that starts from drug discovery, drug development, manufacturing and distribution, and of course sales and marketing. If you look at that, and first three sectors in drug discovery, drug development and manufacturing, CSIR labs played a major role. And in this process, we also developed various facilities across the departments. Particularly, if you look at some of the biology centric like genomics and screening, in terms of medicinal chemistry, protein biotechnology, we have excellent facilities across the CSIR labs. In the area of manufacturing process development, environmental engineering and costing, and we do have good capabilities across the labs. So in next few slides, what I'm going to do is I'll give you some of the success stories from the different labs. So a few decades ago, the CSIR IICT developed a viable process for the AIDS drugs. I'm sure you're all aware of this AZT. So that was a big achievement from the CSIR contributions. So in collaboration with the CIPLA, so this drug was introduced, particularly it made it like a $1 per day that was offered by to the international market, and also particularly this underprivileged market. That was a big success story from the CSIR CIPLA collaboration. And similarly, CSIR Imtech, located in North India, this lab also developed streptokinase, a class-buster drug. So this was given to Cadila, and it was introduced in the market in the year 2001. Similarly, NCL Pune developed amlodipine bacillate, a long-acting blockbuster, and the process was developed particularly by the resolution of so basically it is a mix. Earlier it was a mixture of compound that's called resmic compound. They used a technology for resolution of both compounds. One of the compound found to be the better one. That's how they, based on this technology, it was transferred to MCure and it was commercialized. And similarly, very recently, a public-private partnership between IICT Hyderabad and Aura Laboratories jointly developed and commercialized a misoprostol, a drug useful for reducing death rates during abortion. Again, this is also another successful story between public-private partnerships. And similarly, Nevirapine. So this was developed by CSIR NCL Pune, and again based on chiral synthesis, and this is called NNRTA class of drug. This is being used for HIV. So similarly, a few years ago, L-ephedrine was developed by CSIR CDRI Lucknow, and this was technology developed to this Malladi Drugs pharmaceutical company, and later it was also transferred to other companies as well. Several thousands of tons produced based on the technology developed by CSIR CDRI Lucknow-based laboratory. And very recent success stories from the CSIR NCL Pune. This is a continuous and cost-effective, eco-friendly production of this paracetamol. I'm sure you all know about this drug, how much it is useful across the globe. And this was developed using a reactive distillation technique and established optimum process conditions. And also it was developed organic solvent pre-purification. And this is, again, if you look at the numbers, global acetaminophen market is expected to reach about $1479 million US dollars by 2028. It's a huge market potential. And another technology that is highly efficient and scalable process for manufacturing of azelaic acid was developed at NCL Pune, continuous process, 100% conversion of oleic acid. This is based on ozonolysis technique. And this azelaic acid is being used in cosmetics and also treating acne. That is like a pimple-like kind of thing. It's on a face. And Another success story from IICT Hyderabad. Again, you all know that how tough time we all went through this COVID time. That time, our lab, CSIR, IICT, they developed a scalable and cost-effective process for the synthesis of favipiravir. Very initial days, and it was transferred to Cipla, and it is marketed. And again, the drug is available very cheap now, 100 rupees from Glenmark, and also it is available from Cipla about 68 rupees per tablet. And another success story from IICT Hyderabad is a cost-effective and scalable process for the synthesis of adjuvant, which is part of Covaxin. This is a toll-like receptor 7/8 agonist molecule, and this was if you look at that, many of the ingredients of the Covaxin, this one of the important adjuvant. This was transferred to Bharat Biotech, and very inexpensive indigenous raw materials are used, and this was introduced in the market in the early 2021. I'm sure most of us took this Covaxin as well for the mitigation of COVID. And few other success stories of drug discovery process. So far, I told about process development. Now I'm going to talk about few success stories on drug discovery. And this Centchromone was developed by CDRI Lucknow. This was marketed as Saheli, and it was also included as part of National Family Planning Program in 1995 as Saheli, and also in 2016 as a Chaya. And technology was licensed to this HLL, and it made a big impact in drug discovery in India. And second one is standardized extract of Dilbergia Sisu for the accelerated fraction healing, and also for the management of osteoporosis in elderly women. This was also developed. This technology was transferred to Parmenja Herbal Gujarat, and later it was also transferred to Aveta Biomix. This is again we are also looking at introducing as a botanical drug in USA market. Couple of other molecules, like these are all old drugs, anti-malarial drugs. Again, these are also both are developed by CSIR, CDRI Lucknow laboratory, and both like exported in different countries, particularly underprivileged countries. These are all being served in many part of the other countries as well. And this bacoside extract, from most active ingredient part of this particular extract is bacosides A and B. This was licensed to Lumen Marketing Company, and this is also now available in different countries under different brand names. Another important contribution from CSIR Labs is Rhizorin. It is a unique combination of traditional knowledge with modern medicine to provide effective drug. In this case, what happens is formulation of includes rifampicin, isoniazid, and also piperine. So this will reduce the cost as well as the dose, almost half of the dose, and also 75% reduction in price. And another recent success story from IICT Hyderabad and Sun Pharma. This is one of the much talked about deal between public funded organization and a private partner, and the global license agreement was signed between these two partners, and for the patent out licensing, where compounds with the potential therapeutic activity across multiple indications. And this was also CSIR IICT upfront payment and potential, including everything, it goes up to 2.4 billion Indian rupees, including plus royalties and net sales. And as you are aware, CSIR is very much involved in mitigation of or treatment of COVID pandemic situation, and there are several drugs repurposed. Among that, modern drugs as well as Ayush drugs. In modern drugs, Unipiravir, that is from CDRI and Medigest. We have completed phase 2 clinical trials. Now we are doing larger trial, that is phase 3 clinical trial. And colchicine, IIM, IICT, and Laxai, we recently completed. Niclosamide also partnership between IICT and Laxai, and this is also completed. And chlorpromazine, IGIB, and IACT are being this is also completed. This data being analyzed now. We are going to go for filing at regulatory authorities. In terms of phytopharmaceutical, most advanced one is a EQCH, that is a collaboration between IIIM and ICGB and Sun Pharma. This also completed, and additional like phase 2 trials completed, and phase 3 trials we are in the process of moving forward. And between the collaboration between Ayush Ministry and CSIR, we have taken up 3 different formulations, that is Vitania, Glycyrrhizia, and also Tinospera. And all 3 are completed, and particularly in Vitania case, encouraging results are obtained. In case of other 2, these results are being analyzed at this moment. In terms of biologics, so IACB is working with the plasma technology, and also Cadila Pharma with the Sepsivac, this vaccine, and also in CCMB, our CCMB of Hyderabad, they are working with the mRNA vaccine, so they are all being planned at this moment. And in this process, we have a lot of opportunities and a lot of potential in the CSIR labs. And if you look at recent approvals from 2015 onwards, FDA approvals, about 330 drugs approved. From that, small molecules are about 224, and that fluorine containing molecules are about 65, and 50 peptides are about 15, and nucleic acids are 13. And if you look at biologics number, that is about 100 plus. And these are all tells that where do we go from here? And we need to be we need to look at some of the technologies based on the internal analysis and also discussion with the various experts in the field. We came up with some of the plans at this moment, particularly platforms like flow and automated synthesis, electrochemical synthesis, and photochemical synthesis, and mechanochemical synthesis. These are all things, they are the platform technologies we are going to take forward in the future. In terms of biocatalysis, there are particularly few reactions like oxidation, reduction, CC bond formation, and CC hetero bond formations. These are the focus areas we are looking at. In terms of key starting materials, catalytic and selective fluorinations are very, very important. And also, as you all know, peptide coupling is one of the interesting area where we look forward for new reagents and also catalyst-based reagents we are looking at. And in terms of bulk APIs, recently Government of India identified about 53 APIs where we need to put more efforts in the direction. There is also some scheme called PLI, that is a production linked incentive for the promotion of domestic manufacturing of these key starting materials and also APIs. So CSIR labs are very much engaged with this scheme, and we are all working towards helping industry partners along these lines. And also I would like to give one or two slides on this phytopharmaceutical drug route. This is again new route. This is almost similar to US FDA's botanical drug, but it is with a little more stringent criteria. According to the definition, this is recently passed by this Gazette of India. A phytopharmaceutical drug is defined as a purified and standardized fraction with a defined minimum of 4 bioactive or phytochemical compounds. So that's what the definition we look at for this drug, and it is a new regulation of market, and it is in line with other countries' regulatory markets, and hopefully it will generate much attraction in the global level as well. And along these lines, we have some of the lead molecules. As I said, as part of COVID, we have with the Cocolas Institutus in collaboration with Sun Pharma and ICGP. This is one of the most advanced phytopharmaceutical combination. In this case, we completed phase 2 clinical trials. We are in the process of going forward for phase 3 clinical trials. In other cases like Virginia ciliata, so we filed IND. We are waiting for some of the permissions to take it forward. And we also have advanced formulation with the crocus, that is the saffron, and also disoxylum for rheumatoid arthritis. In case of crocus, we are going for Alzheimer's disease. And also I would like to tell you all that, so in India, we have different scientific bodies, that is a DBT, ICMR, and CSIR. Three came together, and tripartite agreement like few years ago we introduced in 2017, and where we would like to develop these phytopharmaceutical routes, starting from like discovery to the development stage. And what I'm trying to tell you is, like, we have all the capabilities in terms of drug discovery, drug development, process development across the labs, and we will be happy to collaborate with other countries' scientific departments, and also we'll be happy to help along these lines for any other research laboratories across the globe. And thank you all for your kind attention and questions. I'll take it.
Thank you, Dr. Reddy. There is one question for you, but we will take after the completion of this section. So I'll move on to next presentation by Dr. Vinay Nandipuri, who is Director of CSIR Center for Cellular and Molecular Biology. This is arguably the best cell and molecular biology lab in the country, with a sterling track record in the area of cell biology and genomics. So I think, and Dr. Vinay himself is a leading accomplished biologist. So I look forward to his presentation. Vinay?
Yeah, I'm trying to share.
By the way, Vinay is with me here in the same committee room.
Okay. Morning to evening. Good day, everybody. I'm going to talk about genomics and diagnostics, the efforts of CSIR on this front. CSIR has multiple institutes with varied strengths. So, for example, CCMB, where I am working, we work on frontier basic biology and applied research. IGIB is an institute that is heavily involved in cutting-edge genomics. And IMTech is an institute leading microbial technology research. IACB in chemical biology research. IIIM Jammu and CDRI are involved in drug development. In addition to that, biology is also done by other institutes like IICT, NCL, NBRI, CGCRI, CSIO. Like the numbers are pretty good and strong. I would like to structure this talk into pieces. Like, first part, I would talk about the biomedical impacts, implants, rare genetic disorders, omics and its applications, our work on COVID, diagnostics, and finally surveillance. So, affordable healthcare, I would start with the implants, and this is the work done by CGCRI. The Indian orthopedic market, device market, is approximately 16,000 crores. Crores is basically the way currency is said in India. But that is a major, there are lots of Indian requiring orthopedic surgical interventions going forward. So the state of art and affordable technologies are the need of the hour. And that is where CGCRI has developed joint replacements and surface modified implants. These are divided into load bearing and non-load bearing. And you can very clearly see that these such kind of things have been very clearly developed. And they have a, obviously, given the kind of the cost estimate and all, they would expect to be a pretty serious addition to our Indian market. So this is also reflected in the number of industries that have been licensed. The next thing I would like to talk about is rare genetic disorders. We all know rare genetic disorders are a major problem. For example, thalassemia. It can only be identified by sequencing and genotyping. Muscular dystrophy, intellectual disabilities such as Down syndrome, Fragile X syndrome. Some of them are done by karyotyping and some by PCRs. Congenital heart diseases, multi-system abnormalities and genomic screening. So majority of them require cutting-edge newer technologies like next generation sequencing. So given this, we actually have a huge amounts of rare genetic disorders in India. That's simply because of our population being much higher. There are approximately 6,000 rare genetic diseases that affect approximately 300 million people across the world. The burden in India is pretty high because our population is also pretty high. So we have around 70 million people who with rare genetic disorders in India. And there are two reasons for it. Obviously, the genetic heterogeneity and the diversity of our population. The second is also that there is a lot of endogamous populations and marriages among the closer relatives and all that happens. That actually creates an issue too. Awareness of genetic testing is required, need of the hour. India is actually a country where you have wide variety across the, every 200 kilometers, the food habits change. Every 100 to 200 kilometers, the kind of genetic architecture and everything changes. There are 4,635 well-defined populations across India, 532 tribes, and 72 primitive tribes. So given this, it's a terrific place to do this kind of genomic studies and figure out the correlations. In fact, a study that was done by a colleague of mine, Dr. Tangraj, long ago, showed that a lot of admixing has happened over the years in Indian population, the present day population. You can see very clearly over a time scale, a lot of admixing has happened within the population across India. And we are also looking into the genetic diversity in Asia through whole genome sequencing, and we are involved in multiple projects. This is a slide given by IGAB, which is located in Delhi, and basically you can see that there is a lot of international collaborative studies, and these things also are providing us the data on what kind of genetic diversity is there in Asia. So our idea is, CSIR's idea is to create an ecosystem for clinical genomics across India. So we have clinical education and training and genomic research in rare genetic disorders, which I just now talked about. A population genomics that we are going to do, where we are going to look into microbiota to all the way to genome of the people. And we have a lot of genetic testings and high-end genomic tests that are standardized and going to be marketed. We have been involved in diagnostics, and some of the diagnostics have been marketed. We are of course involved in research in drug discovery. These are the various aspects where we have an ecosystem that we would like to use our expertise across. One of such examples would be AMR detection using genome sequencing. This was done a few years ago, then this was done by IMTech. There was an AMR problem that was identified in that there was an outbreak in a pediatric ICU unit. And they ultimately, with the help of sequencing, they figured out that there is a novel clone harboring approximately highly mobile genetic acid. And this outbreak came from amicus in vial lid. So such kind of things we are able to do it because of this. And we have a future program or a currently ongoing program on breast cancer. So our idea is to go for 1,000 breast cancer genomes in both genomics as well as other omic approaches, included integrative, to identify diagnostic prognostic markers for Indian breast cancer patients which are specifically present. Of course, such a work can only be done with multiple hospitals and multiple institutes involved. For the past 2.5 years, the world has been witnessing the biggest problem, that is COVID, and now it's hopefully on the wane. But we were the CSIR was heavily involved in multiple aspects, including diagnostics, vaccine, treatment, and serosurveillance and mitigation. Mitigation is basically giving talks. We have done a lot of that, given interviews. Already, Dr. Reddy has talked about treatment part of it, so I would not touch that. I would be more interested in diagnostics and basically talk about surveillance a bit. So with respect to diagnostic, the first thing that I'm going to talk about is the Ampres biosensor devices. These guys have, they have developed multiple biosensor devices for tuberculosis to COVID-19, and using various transducer materials from graphene to, you can see that metal oxides. In addition to that, the normal way to detect COVID is through put the sample in a viral transport medium, make the RNA and do a qRT-PCR. We have standardized a methodology where we have actually realized that 2-3 steps can be eliminated by putting the swab directly into a dry swab and later on doing a qRT-PCR by putting it in a medium in the middle separately. This was standardized in a CCMB, and CRISPR technology was very well standardized by IGIB. These guys had patent, and they basically use the CRISPR-based technology for diagnosing COVID-19, and this was heavily marketed by Tata MD, and it is one of the most widely available diagnostic techniques even today. So in addition to that, IGIB, in collaboration with various other people, has come up with a software, artificial intelligence in detecting COVID-19 based on the chest X-ray. And this was quite highly successful, 97% of the specificity on Western dataset and 86% specificity on ours. CCMB, along with many other institutes, including IICT, were involved in developing the mRNA platform, which is not something new. It was already developed by Moderna. But what we did is we actually did it end-to-end, replacing many of the components with Indian components, including lipid and are indigenously produced. So for example, what you do in this is very simple. There is a spike protein, which is the surface protein of the virus. We take an RNA template for that, make an RNA out of it, put it into the nanoparticle, and eventually put it into something like a hamster and challenged. This was completely proof of principle was done. There are challenges going forward. One of them is production of the high quality mRNA, producing appropriate sized LNPs. All these things we have encountered and solved. Stability of the mRNA in LNP particles. So we are trying to, this has a larger implications. It can be used for other diseases, including cancer. The critical step is to have some kind of a freedom to operate in India and use this for other things. SARS-2 surveillance is, CoV-2 surveillance is something that also I would like to talk about. There are two kinds of surveillance whenever you talk about a disease like COVID. One is basically the serosurveillance, which we have done time to time. This was done, again, a multi-institutional effort. And what we have noticed is by the time the second wave came by, that is by Delta, there was, at the end of the second wave, already 70 to 80% of the Indian population had antibodies against it. This, at that time, vaccination levels in India were relatively lower, which became much better. Now, right now, 95% of the people have antibodies. SARS-CoV-2 sequencing is something that CSIR spearheaded as part of INSACOG and many other things. And both IGIB and CCMB and some of the other institutes together, we have sequenced approximately 1 lakh genomes and 100,000 genomes. And this is on various platforms, Novasec to MySec to anything that, Nanopore. We used all kinds of platforms to sequence COVID genomes, and we have done pretty good analysis and identified the reasons for mutations in the Delta among the first ones. The surveillance also was extended to air surveillance, and we basically have developed CSIR has developed a biopole air sampler. Using this, we have actually demonstrated that COVID is transmitted, through air. And this is the methodology. You basically put it into the air sampler, pull it out, make an RNA RT-PCR. And we successfully showed that sewage surveillance in multiple cities gives you approximately 1 week ahead notice for a peak that is going to come. So generally speaking, both asymptomatic and symptomatic patients shed viruses in their feces, and this, when it goes to a sewage treatment plant, can be collected, and from there we can extract the RNA and identify. In fact, you can even sequence this. This is quite successfully demonstrated. This works. We have also been involved, in the sense CSIR has been involved in generating the neutralizing antibodies. For this, we have used horses, and eventually these antibodies have now cleared stage 2 of the clinical trials. And once if we get an emergency approval, they're ready to be marketed. So in total, where are we going? With the kind of, just to say that, CSIR, in addition to doing all these kinds of applied thing that I was talking about, we actually do a lot of basic research, and our papers are published in highly accomplished, highly known journals, all the way from Nature till, many other journals, whatever, some of them I listed here. And we have MOU for collaboration with Institute of Posture. We have a lot of fellows from Wellcome Trust DBT India Alliance who are who are working in various CSIR laboratories. The major advantage we have is varied expertise. You can see that CCMB we are going from toxicology research to basic biology research, and that in itself is our strength, and we need to leverage this going forward. And I believe the future is more and more going towards is personalized medicine. With this, I would like to stop and thank you for this opportunity.
Thank you, Vinay. Now there are a couple of questions. I think one question is for Dr. Srinivas Reddy. This question is from Vasudevan from Hokkaido University. Where he's asking about cancer. I think you have read this. I can read that. I read that one. Yes. Would you like to comment on this?
Yes. We do have a program. Recently, we initiated PAN CSIR cancer mission in among different labs, where CSIR CDRI is a nodal lab and multiple labs are involved. But clearly, this is focused on women cancers. And there we are starting from process development to SMAC mimetics and also development of new molecules, NCE developments. They're all being worked in that. In addition to that, we also have one molecule, IIM290, developed at IIM GEMO. So that is also now recently we got approval for phase 1/phase 2 clinical trials. So we are going to take up that clinical trial as well.
Yeah. And also what Vinay talked about the Cancer Genome Project. The second question is, I think Vinay can take it, that is there any initiative in CSR for drug development for rare diseases? Please give an example for any trial underway.
This kind of work is only kind of started in with respect to rare genetic diseases. We are actually the Indian population. We have to really actually go ahead and do the sequencing and all these things. But no, right now we are only talking about possibilities of using RNA technology that we have developed for rare genetic disorders. But it's more like at this point of time at a research stage, efforts are underway, more of trying to figure out how these technologies and some of these things we have developed can be used for rare genetic diseases.
I can add to this.
I can add this one. I can add this one. So right now we are already working on sickle cell anemia disease. That's one of the rare disease.
Yeah.
So that is actually already we are working for last few years, and we have good success also there, and we are taking forward.
Yeah. And then there is a question from Amit Taneja. CSIR lab applying AI technique in drug discovery and development to enable high throughput screening, identify biomarker screening for drug activity, among others.
We are. We are.
Yes.
I mean, now if you are going to go for large scale, that is obviously the way to go forward. Yes, we will be. And
so we have multiple labs are involved, even starting from, I think different labs have different research group, including NIST, Jorhat. We have a director also has a good, Narhar Shastri also has good interest.
Yeah. I think with AlphaFold coming, AI has become part of the integral part. But Dr. Salpamurthy also has a comment that other than, of course, complimenting CSIR for the work, he has asked that please elaborate on CSIR initiative and development of proof of concept diagnostic for large scale screening. Vinay.
Large scale screening. So the proof of concept diagnostic, then we have to start working with companies. In fact, as far as COVID goes, quite a lot of diagnostic companies, not exactly what we are involved in, but they also market in various other parts of the world, which includes at this point of time Dubai. I don't know whether it has gone to Africa or not. But one of the things that happens is if we have the proof of technology and then we start working with companies, we obviously can take it to Africa for sure, because it's all about affordability. Eventually, it boils down to the cost per doing point of care. What is the cost that comes around? Or if you are developing a vaccine, what is the cost of that vaccine relative to what's available in the market? So we have started working on this with companies. And Srinivas, you want to elaborate on this or what?
No, I'm okay.
You can mention this initiative CCMB took during COVID time with this company.
So we had at
Bangalore-based company,
Yeah. So no, we with respect to dry swab also, it was transferred to a company named Merrill, and they've also taken it further. So, but in general, the point is that every time we develop a technology, we start having conversations with the companies, and Hyderabad is a very good ecosystem for having these conversations with various companies. And some of them will go see the market in some other parts of the world.
And Juliet has a very interesting, I think she is trying to tell us something. How can your project and technology be brought to places in Africa? I think this is very, very interesting thought process. And I think CSIR is very actively, I can tell you, thinking about putting some because Africa is an opportunity, because a lot of solutions to Africa actually can come from learning from India. So I think you are raising a very important issue. Thank you very much. And we will engage with you separately, and we'll look forward to if you have some initiative in Africa, we certainly need. Thank you very much for this question. I see the spirit of your question, and it's very, very well taken. Amit also has a question, of course, Srinivas will address that. Among the NC under development at CSR, are these intended for domestic market or also global? How many drugs in clinical trial? Amit is from Netherlands. Srinivas?
Yeah, I think, of course, we love to go for rest of the world also. Of course, initially we look for Indian market, and we also look for other markets. And again, as I said, we have few drugs in the market. I already listed for COVID, particularly we are very active in recent times. And we also have like a few other molecules which are in phase 1, phase 2 clinical trials. And shall we hear.
And Amit, for your information, we are now, during the COVID, we actually collaborated with 2 or 3 international companies, helping them to do clinical trial in India simultaneously while they are doing in their own country. And another thing is because Indian regulatory system is very much harmonized with ICH guideline internationally. So any study that you do here is pretty much sort of conformed with the other global regulations. So it's obviously, So that's and then of course there is a question, are you able to develop a good drug on sickle cell diseases? It's a very interesting question.
Very interesting question. So as such, we don't have any new drug, but recently what we did is this hydroxyurea. This is basically in rest of the other countries, it is already approved for treating sickle cell anemia. But recently we got it approved with the help of CIPLA and DCJ approved. Now we can use legally this hydroxyurea in India as well. Of course, for developing new drugs, it takes time. You all know this is very challenging disease. And right now
I can add, Juliet, that I'm engaging with one US company which has recently got approval for a small molecule for sickle cell disease, which is approved by US FDA. And I'm interacting with them how fast we can bring that drug to, because India has 20 million people, minimum 20 million people with this disease. Global burden is really very high. So we are running a project for genetic counseling and all that, but there is an antibody also, that has been approved. So now India will come into play, making that antibody affordable to global population of sickle cell people. So thank you for raising this question. I think I will have to stop here in the interest of time, and we go to the third and the very interesting session on water, basically water and life below water, SSDG. And as you know, introduction, I would say that India is 1.4 billion people. Managing water resources is a great example historically for the world, because we are endowed with all kinds of water resources. We have close to 10,000, 12,000 tropical warm sea. We have Himalayas, glaciers, and we have the complex water system. And I think Indian science and particularly CSIR has been into this area. And of course, we have a greater challenge to provide potable as well as irrigation and all kinds of water resources to our people with the climate change or sitting on our head. So this is a very interesting session dealing with several of sustainable development goals, and we have a very eminent speaker in this session. I'll start with the potable water, which Dr. Kanan Srinivasan, who is director of our coastal lab, Central Salt Marine Research Institute in Bhavnagar, which is a very well located for addressing water problem, and we look forward to hearing from Dr. Kanan the solutions for this particular problem, which is a global problem.
Yeah. Ram, is my slides are visible?
Yes.
Yeah, fine. Thank you. Pleasant evening from this part of the world, and wherever the part of the world, pleasant day for you guys. I'm going to talk about the CSIR intervention on potable water specifically. Dr. Ram has basically given a kind of a complexity of the problem, where I mean the opportunities have also been told, and handling a kind of a roughly 20% of the global population. Managing water is not going to be a kind of a great easy task, and with this added complexity, it's going to be, I mean, further posing challenges. And in fact, I mean, of course, as everyone knows, this basically talks about the UN Sustainable Development Goal, which is very clearly said, clean water and sanitation are extremely important for sustainable development of the whole planet on the whole. And if one were to basically talk about it, the challenges, I took it from the last part of his introduction, the challenges. The challenges are pretty grim. Okay, the reason is the groundwater exploitation has been phenomenally high, especially for the developing nations, and this is really going to pose a kind of a great difficulty for the water availability. And it is estimated roughly, I mean, 1/5 of the population, world's population, is going to be having a kind of a risk of having a kind of a clean water. And there are few nations are very specifically indicated where the water challenges are going to be great. And addressing the challenges in those places are going to be a kind of a very complex exercise in the next, I mean, 20-30 years down the line. And this is coupled with a kind of another challenge, where I mean, you have a kind of a coast, like country like India, where I mean the intrusion of the sea is also going to make a kind of your water saline. And this is adding, one way we are basically depleting the groundwater source, and in the other way that we are basically making the water also not potable. So these kind of a complex scenarios, and the reasons for this particular salinity ingression is both by natural as well as anthropogenic, which is indicated on the left side of the graph. And these are going to be causing a kind of a great, a threat, I would say, a threat for the planet, especially a large part of the planet, for its survival. And if I were to talk about the country which I belong, if in the last 75 years, as we celebrated our Indian independence, the availability on a per capita basis, we've reduced the water by 1/4. What does it mean? I mean, if water is available for 100 liters at the time of our independence, now it is available at the, on a per capita basis, it's only 25 liters. And this is a grim challenge. And that's the reason you see the entire CSIR labs, at least around more than half of the CSIR labs, which are pointed by the pointed arrows, are all engaged in one way or other in addressing this water challenge. And if one were to basically look at it, what would be a kind of a way by which you can address it? Largely, I mean, 4 different, easy to understandable baskets: purification, desalination, sourcing, and harvesting. Purification, it could be basically anthropogenic as well as geogenic. I mean, the previous speakers talked about addressing the diseases. So clean water basically have a kind of an implication on the health as well. So pathogen removal, toxic elements removal, toxic ions removal, turbidity, and all these things are going to have a kind of a great challenge, because the purified water gives you a kind of a greater opportunity for a greater health. And likewise for the, I was talking about the salinity ingress. So the desalination is going to offer a great, challenges in those particular domain, where it could be even seawater or brackish water. Brackish water essentially means that the TDS is not to the level of seawater, but it will be something like around 1/3 to 1/5 of the seawater. And sourcing, I was telling you about the groundwater. How do we basically map it? How do we recharge it? And how do we rightly manage and rightly used water is going to have a kind of a great implication in our survival, and also on the wherever the sourcing one can basically get it. We should be in a position to basically go ahead and then search for those water zones. And if I were to talk about on the technology point of it, especially on the CSIR technologies, where we have been working for the last at least 5-6 decades. Largely, I mean, we work on membranes and then of different configurations, then adsorbents, then complexing agents, extractants, and some physicochemical separations. The processes are basically mentioned. I don't want to read about it. These are the broad areas by which one can address about the way by which you can treat water. And I will rush through some of the examples to give a kind of a flair about how these technologies have helped the mankind and how they are basically going to have implications in the years to come. And this is one of the classic example, the cellulose acetate membranes, which were developed a long time back. Even at that particular point of time, India was very proactive in solving the needs of the rest of the world. And in this particular case, for the first time, a 30,000 liters per day kind of a plant was given to Thailand for addressing the drinking water needs. And there were challenges, and the challenges led to a kind of a development of a new generation membranes, which is called as thin film composite membranes. And these thin film composite membranes, the perfection of the technology was done at CSIR, and this particular technology has been put into a kind of a deployable manner in the form of a plants and put into across the country, and several places where water was basically giving a kind of a difficulty, where the water is saline or brackish, which means according to the World Health Organization, the water TDS should be less than 500 ppm, and whereas here you will be ranging from 1,000 to 35,000 ppm TDS. And that's the kind of a water that we are basically addressing. And this particular technology, which is a kind of a state-of-the-art technology, has been perfected by the CSIR. And this technology, a very recent example, has been demonstrated in one of the states of this country called Gujarat, where 100,000 liters per day kind of a capacity was installed in a very remotest location where no drinking water was available, and where the entire water from the ground is brackish, which is of the order of 10 to 12,000 ppm TDS, and where we have put this plant, which is serving something like around 1,000 people in the particular region. And one solution doesn't fit all as far as water is concerned. It has to be a kind of a complex and dynamic, and the technologies also need to be very, very dynamic. And this particular ultrafiltration membrane technology, which is pioneered by several laboratories of CSIR, is essentially addressing on the pathogens and also on the especially bacteria and virus, where you can have a kind of a very good log, roughly around 4 to 6 log reduction of these pathogens, thereby providing a kind of a drinking water. And these kind of solutions are extremely pertinent for the urban population, where the provided water doesn't require any kind of further additional treatment in terms of removal of ions, where if you can address only the turbidity and address only the pathogens into it, we should be basically having a kind of a cleaner drinking water. And hollow fiber membrane technology is one such kind of a technology that can address this particular case. And this is an extremely important ideal solutions for urban settings. And these particular technologies have been continuously been upgraded. And the recent technology that we have developed is in a position to provide water at a kind of a very, very high flux, which is roughly of the order of 1.5 liters per minute, and a kind of a very, very gravity pressure driven processes, where electricity is absolutely not necessary, and a perfect solution where only the water is very well within the TDS, but the pathogens are the concerns of it. And likewise, there are situations where the hardness of the water is causing a kind of a great difficulty. For addressing the hardness, you need to have a kind of a different sets of membranes, where nanofiltration membranes, which is a kind of a in between that of ultrafiltration as well as the thin film composite membrane, can do a kind of a great opportunity to address these kind of challenges where the hardness of the water is removed. And there are solutions where, I mean, you need to have a kind of a high water recovery, where ion exchange membranes comes in very handy, where the recovery of water. What does it mean by that? In terms of the feed water volume vis-a-vis the permeate volume, you need to have a kind of a very high permeate volume for it to be more efficient. And where these kind of an ion exchange membranes, which involves a process called as electrodialysis, treat this kind of what you call near brackish water of the order of up to say something like around 5,000 ppm to a kind of a potable water that could be what you call with a kind of a very high recovery. And in cases where, I mean, healthy water needs to be given, a precise control of the ions that is going to be present in this water can also be addressed by this particular kind of a technology. And this is not only with respect to a kind of a standalone kind of a plans. This can also be done in a kind of a mobile kind of a plans. The versions are basically shown on this particular slide. And whether it is a kind of a modular ultrafiltration systems or a mobile desalination systems, all these kind of a systems developed by the CSIR can be basically put into use. And one of these example is, especially in the case of the natural disasters, which is omnipresent across the world. And these kind of solutions, mobile solutions, water solutions are going to be a great, what do you call, solace. And this particular case, roughly around more than 10,000 population were deprived of drinking water after the cyclone has been provided the water. And likewise, as I said, different pockets of the countries has different kinds of problems. In this case, I mean, arsenic and iron are need to have a kind of a particular concentration in our water, above which it is going to be a kind of a toxic to our human physiology. And these particular kind of membranes, which are ceramic in nature, developed by CSIR, is addressing the issue of both these toxic ions by limiting the kind of conditions. And all these technologies have been licensed to different clients, and manufacturing and what you call putting these plants in places have been happening across the country and beyond the country also. In fact, I mean, some of our desalination plants have been put in places like Kenya and Afghanistan. It's not only the membranes, different kind of an adsorbents like resins are also essential. I mean, essentially addressing, or polymeric adsorbents, or essentially addressing the removal of different toxic, what do you call, pollutants like arsenic in this case. I mean, a very simple material which is naturally available, made as a kind of a filter called as terafil, and which address a kind of a very good iron to a removal percentage of more than 90-95%, with a turbidity removal of 99%. And a very simple, I mean, what do you call, naturally available material can be put into this kind of what do you call, cost-effective solutions. And these are also can be basically integrated into a kind of establishments like hand pumps, where, I mean, you can just fix these kind of materials, fix this kind of an adsorbents, which would address toxic elements like arsenic, fluoride, iron, and all those kind of heavy metals removal. And this is one of the classic examples where you do a kind of a chemical defluoridation, where a kind of electrocoagulation, where the in situ generation of a chemical is taken into consideration for the mopping of iron through a kind of a complexation chemistry. And likewise, I mean, different kinds of technologies have been tried out for addressing the different kinds of situations. And in fact, I mean, there is one very interesting technology. Can I basically get all the previous technologies requires water is available, and it requires a kind of a treatment of water, where here in this particular kind of a technology, even, I mean, a very humid kind of a conditions, water could be basically harvested through a kind of an extractant based technology, where the water can be little remineralized for providing as a kind of a potable water solution. And as I said in the beginning, it is also equally important that we need to have a kind of a right water use management, and where technologies like IoT, sensors, artificial intelligence, machine learning, all these things are integrated. And one such example is basically shown in this slide, where we are trying to integrate all these technologies for the right water management, which ensures both quality as well as quantity of the water fed to the people to the last mile is basically taken care of it. And this is currently demonstrated in a couple of our locations within the CSIR establishments, and which will be basically taken further to rest of the villages of the country in a kind of a pilot mode. And soon, maybe in a decade from now, the entire villages of this country would be having a kind of a quality water, which is maintained both in terms of quality as well as in terms of quantity. And what I essentially wanted to cover is a kind of a telescopic or a kind of a helicopter view of water technologies that are available. In fact, water mapping, I was telling the Dr. Kalai has mentioned in her opening welcome address about CSIR, where she mentioned about the heliborne mapping of water management in the groundwater management. So all these technologies are given in this particular compendium, which is available with CSIR for any country which is basically looking for plans, processes, solutions on potable water, whether it is on purification or desalination or mapping or harvesting or quality and management. Please reach out to the CSIR. And I'm sure that, the technologies, the competencies, the laboratory diversity that we have in the country would be a great place for addressing the challenges, as well as for doing a kind of a very high-end research in making the planet to be a habitable one. Thank you very much for your kind attention.
Thank you. Thank you, Dr. Kanan, for actually sticking to the time and very clear presentation. Now we will move on to next important presentation by Dr. Atul Vaidya, who is director of a very major CSIR lab of global standard, which deals with the environment engineering and solutions, and also at times serves as regulatory body for laying down rules and regulation for industry in India and all kinds of issues that country like India faces. So I think World Sustainable Goals of United Nations, I think this is the one lab where a lot of solutions can come, which could be of global importance. So Dr. Vaidya is going to talk about wastewater management. Dr. Vaidya, please.
Yeah. Thank you, sir. Thank you very much. I'm sharing my screen. Is it visible?
Yeah.
I'll make it in slideshow. Is it visible?
Yeah.
Okay, thank you. All greetings to all dignitaries and participants. Good afternoon, good morning, good evening, and Yasuminai for Hokkaido participant in Japan, where almost it is 10 p.m. plus. So I'll be presenting on the important topic of wastewater treatment and management, challenges and opportunities. And I'll be focusing on CSIR capability in this area. As all of us are aware, that environmental engineering is a multidisciplinary subject. It's not a domain of one single lab. And I would say that practically all CSIR labs are contributing to environmental research, including NERI. And therefore, whatever I'm going to present right now will be a structure of wastewater management system and the capabilities of CSIR, collective capabilities of CSIR, not a specific lab. And therefore, it's total CSIR capability, which I will be depicting in this presentation. I would like to mention here that all engineering and engineering labs are contributing to wastewater treatment through their innovative designs and engineering and design capability. Chemical science labs are contributing to different chemical treatment systems. They are innovative. And biosciences labs are actually basically helping wastewater management systems by developing a specific consortia which are very helpful for quick degradation of industrial waste. Now, before I get into the subject, I would like to give stress on certain things. What are the local and global challenges? These are equal if you go to different countries. These challenges and these problems are there in different forms. Major thing is collection and conveyance of the sewage. Now, all of us know when we talk of sewage, it has to be first collected and conveyed to a central position, or else you will have to have highly decentralized systems. And therefore, maybe in India, almost 40% of the sewage is only collected. Rest of the sewage is not, conveyance systems are not there, and it's a big challenge. Secondly, there are a lot of administrative and financial issues, including the, it's not like a simple system. You need a lot of clearances, lot of statutory clearances, and a lot of financial issues are also involved. The single most important thing is that you have to adopt to the customized technological solution. There is not a single solution which is generalized. It can be generalized or can be applicable to any situation. You have to look for the situation and you have to study the specific problem in details. And of late, GHG emissions from wastewater treatment system and fecal sludge and septic management has become a focus of the research because, as you know, wastewater treatment plants do release carbon dioxide and methane if they are not properly treated, including N2O also. Now, if you look at the wastewater treatment systems, you have to develop a system right from its wastewater characterization, wastewater quantification, suitability studies, and then you have to look for feasibility studies, then you have to make detailed project report, and finally, then you have to implement the system and commission it. And it is not a generalized task. It has to be very specific to the problem and site given. And therefore, you need feasibility studies, basic engineering package for the sewage wastewater treatment, and CSIR is highly capable in doing this. Renovation and upgradation of sewage or effluent treatment plants. I am going by general capabilities of the CSIR because we come up with these problems. So we can start with zero and give a complete solution, or we can help you in renovation and upgradation of existing treatment plants. We can develop technologies to facilitate compliance with the discharge norms. There are many facilities in the country and outside country also, which are basically not complying to the norms, the discharge norms, and therefore we can help. CSR can help them in complying this. Zero discharge based wastewater treatment technologies are also available with CSR. We also work out for cost apportionment for different common effluent treatment plants. Now, I would like to say here one thing, that many small and medium scale industries cannot afford individual plants, individual wastewater management plants. So they are into common effluent treatment plants, and major issue is the who will bear how much cost. And CSR also helps in those kind of things into wastewater management. Recycle and reuse and resource recovery are major areas where all CSR labs are focusing. Then domestic and laboratory wastewater treatment, that is new area which is coming up. And then if you have good segregation of wastewater like grey water, then grey water recycle and reuse is another domain where CSR is very efficiently working. Other areas which we also work on scale up of the wastewater treatment technology, because that is very important thing from engineering point of view. Small scale technologies have to be scaled up for full scale technologies. Natural purification systems for wastewater treatment. I will come to that later on. Modeling of wastewater treatment processes, advanced methods for removal of nutrients from wastewater, like advanced oxidation processes, which are being used for even taking care of PPB or PPT level pollutants or priority pollutants. Monitoring and removal of volatile organic compounds. Land application of treated wastewater, that is another area which is picking up. Disinfection of water, sewage, and already it has been discussed in earlier presentation. Fecal sludge and septic management is going to be a huge challenge in coming years, because under Swachh Bharat Abhiyan, lot of toilets have been installed and are in operation, but septic management system has to be properly placed along with those things. Otherwise, these are going to contaminate water again. Then what CSR has done so far, because this is a collective milestones or collective credentials of the CSR, that we had done a lot of turnkey projects for CTPs, like for at Pali, Balodra, and CTPs in Delhi, CTPs in Chennai cluster, CTPs in Tannery clusters, CTPs in distillery clusters near Chennai, and so on, and many CTPs in Gujarat. R&D studies on textile SS rolling mills for different industrial sectors also CSR has worked extensively. Development of techno-economical treatment processes for domestic and industrial wastewaters. Implementation of decentralized STP based on natural and compact treatment systems under different international programs, including UNEP, and Indo-EU programs. Societal missions, and CSR is exclusively supporting to any High Court or National Green Tribunal or Supreme Court cases which are actually dealing with public interest litigations related to wastewater management and other litigations. Now, the major challenges which we face in wastewater management, which are to be resolved, and we are successfully resolving those challenges, are basically pertaining to social challenges, administrative challenges, financial and technical challenges, out of which CSR is basically working on different technical challenges which are posed right from so many years, and every time we are coming up with new challenges, new priority pollutants, and therefore CSR has to develop new technologies and implement that. And of course, this gives us opportunities for research. This gives us opportunities for pollution prevention, for recycle, reuse options, energy generation. Now, in coming years, if we look at the earlier presentation that by 2050, if India is going to be starved for fresh water, then what option we are left with is the complete treatment and reuse and recycle of the wastewater which is generated, or industrial wastewater that is generated from industries, and thereby reducing the stress on the fresh water. And therefore, pollution prevention, recycle, reuse, and energy generation will be a key to in coming 20, 25, 30 years to cope up with the challenges which are being projected in 2050. And therefore, goals which CSR would like to meet in this area is sustainable development and environmental conservation. Mostly, wastewater management is related to sustainable development goal number 6, and nowadays partially to number 13, that is related to climate change actions. Now, wastewater treatment is not easy task. It's not a product development asset. We have to meet certain norms, because when you are dealing with wastewater treatment, you cannot say I have treated to this extent or that extent. There is a typical norm. For example, nowadays for sewage in India, we have National Green Tribunal norm which specifies what should be the BOD of treated wastewater. It should be around 10 milligrams per liter, and so on. Likewise, all state pollution control boards will have different norms for different kind of industrial wastewaters which are released from the industries, and your wastewater treatment is efficient. It should be efficient, not only efficient and economic, it has to comply with these norms. Otherwise, there is no use of putting a wastewater treatment system, because these norms are basically developed to protect the environment under the conditions. And therefore, with all these capabilities, CSR has aligned itself with different missions of Government of India, like Swachh Bharat Abhiyan, Smart Cities Mission, National Plan for Conservation of Aquatic Ecosystems, and so on, Namami Gange, National River Conservation Directive. There are so many programs which are going on in India, which are supporting R&D as well as practical implementation of wastewater management systems. And CSR has aligned to all these, are working for all these national programs. In addition to that, CSR is also working for many projects related to wastewater treatment systems, along with international agencies like JICA, UNO, UNEP, and UNIDO. Now, coming to the basic structure of wastewater management systems, you will find that I will not get into the details, but I would like to just focus that how CSR is contributing. There is basically a primary treatment system, secondary treatment system, tertiary treatment systems, and advanced polishing treatment system. Now, these are the 4 things which are actually required, or this is the structure of sewage treatment or any industrial waste treatment. And you can see that what I said in the beginning, that all CSR labs are contributing to wastewater management in this way, that aerobic, secondary aerobic activated sludge process, trickling filter, membrane, all these technologies are basically refined by CSR laboratories. And in addition to that, our biosciences labs are basically contributing by developing a very efficient microorganism, because all these aerobic processes are basically biochemical treatment processes. And we need a lot of good cultures which can survive the practical situation, field situations. And all our biosciences labs are contributing by development of consortia. In primary treatment, many chemical sciences labs are actually basically contributing by developing the different adsorbents, different coagulants, efficient coagulants, key coagulants, which can take care of economics and efficiency of the primary treatment. Also in tertiary treatment, you will find that there are host of CSR laboratories which are working on tertiary treatment, including disinfection, solar-based ozonation, UV, all contributing to as it has been said in the earlier presentation, ultrafiltration, nanofiltration, and reverse osmosis systems also can be used for wastewater management system. In addition to that, wastewater management system also includes sludge treatment, because a lot of sludge is generated into wastewater management, wastewater treatment, and that sludge has to be managed properly in environmentally sound manner. And all CSR labs are definitely contributing to different. I would like to skip specific names, but I know that more than 20-25 CSR labs are basically working in this area and contributing to the best of their capability to make wastewater management system a successful story in India. Then the major issues which we face with wastewater management system is there is a criteria for wastewater systems. One is economic criteria, which looks for capital cost, OM cost, and land area. Now, all of you will realize that Indian system needs low capital cost, low OM cost, and minimum land area. Of course, this is not technically feasible always to match with. But then, through our research, we are finding out the trade-off between capital and OM cost and land area requirement, giving customized solutions, so that basic compliance to the standards is not sacrificed. And the technical criteria, as I said earlier in the beginning, that it has to be complying to the standards like BOD, COD, and TSS removal, nutrient and coliforms removal, treatment time, sludge generation, handling, operating flow capacity, permeate recovery, TDS removal, rejects. Every system will have some problems, and those problems are to be considered and given solutions for. And finally, administratively, you have to look for ease of operation also, because it has to be operated by not very skillful set of operators and designated end use of the treated system. Now, you can have different treatment systems if designated use of the treated wastewater is for irrigation or for release into the water bodies or for reuse into the process or domestic purpose. Accordingly, the treatment sequence and treatment train and cost and everything will be determined. And CSIR is capable of giving different packages as per the need of the situation, as per the need of the situation in terms of land area, financial capabilities, and so on. At present in India, activated sludge plant is the most popular thing. Still, there are a lot of plants, but you will find that in coming years, a lot of new technologies basically developed from entrepreneurs from CSIR or CSR laboratories are getting into the vogue, getting into the practice, and we are slowly shifting away from conventional activated sludge plants to different new technologies, which I will not get into the details because of the want of time. And this figure you will see that from waste stabilization ponds before 1970s, we are shifting to sequential batch reactor systems, membrane-based bioreactor systems, and different active media-based biological systems, which is actually a contribution, collective contribution of all CSR labs and R&D taking place in CSR labs towards wastewater management. And fecal sludge management is also gaining momentum since the launch of Swachh Bharat mission in October 2014. There are a few examples which I would like to quote. CSIR is many CSR labs are working on sustainable solutions based on the natural attenuation system, because we are working on the combinations of engineered systems and natural systems, so that we get the advantage of cost and advantage of efficiency. And this is one of the examples. I can show the flow diagram, but I will not describe in details. But you can see that there are a lot of natural things which are used in different areas. Of course, this has to be looked into the land requirement option. but it is very low capital and OM cost, and energy generation also is feasible through anaerobic systems. These are a few examples which are already installed in place through CSIR laboratories. You can see different wastewater or sewage treatment plants, kind of decentralized plants. I would not say totally decentralized, but for a community or for small villages or small towns, these are sewage treatment plants which are developed and are in operation, complying to the norms of the State Pollution Control Board. Also, we are into a very refined kind of treatment plants also, where the industry needs for that, and CSIR is capable of providing state-of-the-art treatment systems, including all modeling and modern tools, including drawing, design, and everything. As a completely professional engineering job, CSIR labs can do for a wastewater treatment system. This is, for example, you can see 450 cubic meter per day plant, which is based on submerged aerobic fixed film reactors, which is a new technology. It also utilizes natural systems. It utilizes anaerobic systems. It recovers energy as far as possible, and it gives a good option for wastewater management system. We have, as a case study, I would like to present here that we have worked for SEZ area in Chennai. Right from the beginning, that's what I said in the beginning, wastewater management is a total package. You have to start from the beginning. So we analyze the total industrial area, different types of industries, different types of effluents which are generated from different industries, quantum characteristics, and then we have come out with solutions like this, which are actually suitable as a CTP to all collective effluents, and you will find practically all primary, secondary, and tertiary treatment systems in this flow chart. And a basic engineering package has been already given to the customer. Lastly, I would present that CSIR labs are also involved into greenhouse gases, or you can say climate change issues pertaining to wastewater management system. The major issues are CO2 and methane and N2O, which are CO2 and N2O are generated in aerobic systems as well. Methane, if not recovered and if not properly, wastewater is not properly treated, you are likely to get methane out of it, which contributes to climate global warming as a greenhouse gas. CSIR has been working in the GHG inventory for India for IPCC since long. I think since 1980 onwards, CSIR is working on this GHG inventories, and we are contributing to national communications throughout all these years by our exact inventories which are pertaining to wastewater sector, along with other waste sectors. Last, I would like to give focus on the new areas of concern and the solutions which are being offered by CSIR. As you know, Swachh Bharat Mission is lot of toilets are provided into the rural areas, and the septage from the toilet is not basically treated properly. At present, there is no coupled system, and septage has to be collected by tankers and it has to be properly treated, for which CSIR has developed a system which can generate some methane also, which can generate some fertilizer, and which will get rid of all pathogenic, you can say, contamination which is there in the fecal sludge. These systems are pilot scale. These are being operated at different small locations, or especially in rural areas. I would like to say that for last CETP, common effluent treatment plant, is a necessity in India, because medium and small scale industries cannot afford full scale plants, independent plants for wastewater, their effluent treatment plants, and therefore they depend on CTP. And there are almost more than 38 CTPs in India, and CSIR has contributed to almost 38 CTPs in this area by different, right from feasibility studies, design, operation, troubleshooting, cost apportionment, and so on. So CSIR is contributing to wastewater management in India in sewage as well as in industrial wastewater as well. A way forward, there are certain SDG goals which pose certain challenges, like you have to end open defecation and provide access to sanitation and hygiene, improve water quality, wastewater treatment, safe reuse. As I said, if 250 scenario is going to come that we will be water-starved country, in that case we have to go for complete recycle of sewage, complete recycle of industrial wastewater, and for which identification, treatment, and removal of emerging pollutants, then targeting recycle reuse of target treated effluent instead of meeting environmental discharge, meeting compliance with that is only partial target. We have to look for this complete recycle and reuse of the industrial wastewater, and then adopting a combination of natural and advanced technologies to ensure techno-economic and sustainable solution. Because right now, there is a claim that wastewater management systems are costly, not affordable, but we cannot sacrifice the basic science and technology involved. Also, we have to go for natural systems. So CSR labs are working on combinations of both of these things so that we get capex and opex advantages. So with this, I will stop. Thank you very much. Of course, there are any questions and time permits, I would like to answer whatever I am. Thank you very much, sir.
Thank you, Dr. Vaidya. I think there are questions we will come back to at the end of the session. I'll now move on to the next and last presentation by Dr. Sunil Kumar Singh, who is Director of National Institute of Oceanography of CSIR. It's a leading institute globally. If I can see, I put this institute in top 3 oceanography institute in the world, which are dealing with these problems. And as I mentioned in the early, that India is uniquely placed with very large coastal area and different situations. So I think we like to hear from him, and particularly the topic that is going to be presented is very, very important: impact of climate change on Indian Ocean. Dr. Singh, please.
Yeah, thank you very much. Namaskar and greetings from coastal state of Goa to everybody. Are you able to see my slides?
Not really. We see a little now. Yeah.
Okay, thank you very much. So, yeah, actually now I will be talking about oceans and SDG 14, which talks about life below water. So I know, as you know, ocean represents the 90% of the biosphere, and more than 2 million of species are residing there, almost 90% of the total biosphere. So it is very important to understand how they are behaving, and particularly in terms of climate change, because has become a big parameter which is impacting the life on everything in the ocean. So it is important to see its impact. So I am planning to give 1 or 2 success story which CSIR has done in the field of oceanography, and then we'll be talking about this impact of climate change, which is becoming very, very important. So as everybody is aware, ocean is a very important component of Earth system science, which is very vital for mankind and very crucial for climate. And in terms of local drivers, actually, they are very important in terms of both living and non-living resources. As everybody is aware that a lot of foods are coming from oceans, a lot of minerals are coming from oceans, and actually transportations are dependent on ocean. And actually, in terms of climate, if you see, oceans are a big parameter which is impacting the global climate. Our monsoon is being affected by ocean, and also the global temperature, everything is controlled, or CO2 is controlled by ocean. So in that sense, it becomes very, very important. So if you talk about this SDG 14 of United Nations, which talk about the conserve and sustainable use of ocean resources, we know that as we have seen different kind of living and non-living resources. So when we are talking about living resources, fisheries and all, always a problem of over-exploitation is there. Although in India, it is still not the case, because our potential in the exclusive economic zone for the fisheries is more than 5 million ton, whereas we are only extracting 3.7, 3.9 million tons. So still there are possibility to go for more. But in terms of other stresses which are put on the ocean, like global warming, eutrophication, acidification, we need to look into that when we talk about the sustainable use of ocean. And because of anthropogenic activity, global warming, most of the heat is going to the ocean, sea level will be increasing, acidification is happening, eutrophication because of huge amount of fertilizers and other usage which is happening on the land, it is going to the ocean. So those things are putting a lot of stress on the ocean, which needs to be looked into. And when we are talking about ocean, actually it is very important subject in the context that we are also celebrating Ocean Decade of Ocean, that is Ocean Decade during the 2021 to 2030, which talks about develop the science and scientific intervention to get the ocean what we want. So the vision is to the science we need for the ocean we want, actually. So a lot of emphasis is there to develop the science or scientific intervention to take care of the problem which is there in the ocean for its sustainable use or whatever the problem it's coming because of anthropogenic activity, how to solve that. So there are 7 outcomes which has been described to talk about a clean ocean, a healthy and resilient ocean, a productive ocean, a predictive ocean, a safe ocean, an accessible ocean, and inspiring and engaging ocean. So in all these 7, I think scientific intervention is very, very much required. So how we are prepared and how we are we are efficient enough to deal with all the problems. So we can say that CSIR is really means we are capable enough to deal these problems by 2030, at least in terms of Indian Ocean is concerned, because we deal with every aspect of oceanography, whether it is physical, biological, geophysical, geological, engineering, pollution aspect of water around India, or we talk about even marine engineering, or you talk about archaeology. I think we are taking care of all the things, or we are capable enough to do that. In addition to that, we are also capable enough, or we are providing services to the industry, government and non-government organization in terms of consultancy and contract research. So our strength, as you told me, we are dealing with all aspects of oceanography. And also we are equipped with different capabilities, like we have 2 big ships in CSIR, which can take care of the study which we can take in the Indian Ocean, which is almost 71 million square kilometer area, and which is impacting directly the economy of our country. And particularly it becomes very, very important when you are talking about this deep ocean mission and also the blue economy. Right now, if you see, it's contributing, this ocean economy is contributing about 4% of GDP. But when you want to have 5 trillion economy, this ocean economy has to go in double digit, and then it becomes very, very important. And hence the CSIR contribution in this regard is very, very important. So one of the success story, it talks about the polymetallic nodules, which the last several years of work, maybe 20-25 years of work, has led to very important outcome, and based on which only this is a very important component of deep ocean mission, where the efforts are being made to extract these minerals from the ocean. And because of it is CSIR, the effort which has been done in last several years, actually we were able to scan almost 3 lakh square kilometer of area in the central Indian Ocean, and we have based on that, actually now we were identified as pioneer investor, and we were given right to do mining, and we are working in that direction. And based on our effort, we are able to estimate or explore the dry nodules of almost 400 million metric ton with manganese, nickel, copper, and cobalt. And you know, some of these minerals are very, very important, because when we are talking about green energy and all the critical metals like nickel, copper, cobalt, and even platinum group element and rare earth elements which are there in the ocean, which a lot of work is CSIR is doing in this direction. It's very, very important for green energy, in terms of green energy or the batteries and all those things. So you can imagine the work which has been done and the work which are going in this direction is really, really important for the coming bright future of the Indian economy. Another very important aspect or some success story is this identification of the additional area in the Indian Ocean. Actually, you know that exclusive economic zone which extend up to 200 nautical miles, is given the sovereign right of that particular country. But in addition to that, there is also a rule that the coastal state can extend their sovereign rights to explore and exploit the natural resources of the seabed and subsoil beyond exclusive zone if they can prove that. And in that regard, I think NIO has done significant amount of work. And in addition to the existing 2.02 million square kilometer, we have identified additional area of 0.6 million square kilometer, which is we have put the request to for the allotment to the India, and I think soon it will be done. So this is again a very successful story. And in addition to that, as you know, the coastal area of India means a lot of development is taking place, and everywhere I think this CSIR is contributing a lot in providing the support to develop those industries or develop those some of the factories and all those things. So we are helping ports and harbors, shipyards to develop the ports in terms of breakwater design and all those things. We are developing or helping the oil gas companies, ONGC and all to in terms of geohazards, and also the helping to identify the location for the laying down the pipelines and cables, power plants, chemical pharmaceutical company. So we are helping also the strategic sector like Indian Navy, Space Application Center, Nuclear Power Corporation, BARC, etc. So now our focus is on to see the climate change, because you know the climate change is going to impact the life below water. And not only it will impact the biology, but it will be impacting the biogeochemistry and the monsoon, because the contrast of the land-ocean contrast of temperature will be diminishing. So monsoon will be impacted. Also, it will be impacting the physical condition of the ocean currents and all. So in this regard, a lot of study is being carried out and planned to do that, to see how it is impacting, because you must have noticed this hazardous blooms which is happening in the ocean nowadays, which will be very harmful to the fishery, and also the decrease in primary productivity, which is reported because of the global warming, and also the acidification which is increasing and which will again indirectly impact the productivity. So sea level rise and all these aspects has to be looked into in detail to keep the ocean resilient, so that it can be utilized in future also. So just to give a brief idea that ocean are controlling the CO2 level in the atmosphere by taking those photic zone that CO2 is getting fixed by photosynthesis, and it is taken by the phytoplankton and zooplankton and going to the fishes, and part of that is going to the sediment, and in that way it is removing the atmospheric CO2 to the sediment which is permanently settled, and in that regard it is controlling the temperature. So productivity in that sense is very important, but the entire ocean is having, in productivity is very, very different. The warm color shows here that high productivity, whereas the blue colors or the cooler color are showing low productivity. And you can see that oceans are having very different kind of productivity. So how this will be impacted by the global change, that I will tell in next few slides. So in terms, you can see this, the impact of climate change will be much more on the Indian Ocean because of its geographical location, because it is not pole to pole, because if you see it has a low latitude land boundary, and because of that the situation is very, very different. And also actually a lot of material is being supplied by the different rivers coming from Himalaya, which is developing the stratification in the Indian Ocean. So altogether, if you see, this Indian Ocean is very, very different compared to the other ocean, and here the impact of climate change will be very, or it has been already observed that impact is very, very high. So you can see here, this is the impact of global warming because of the greenhouse gases. And now you can see that temperature is continuously increasing. It is not a myth, that it is observed now. And you can see that because ocean is absorbing most of the heat, that is more than 90%, so it is increasing continuously. And global ocean is increasing by almost 0.1 degree per centigrade per decade. But the Indian Ocean, this increase is 0.15 degree centigrade per decade. This is almost established. So Indian Ocean is warming a much rapid rate. You can see here that it is also very clear that the tropical Indian Ocean, the increase is 0.15 degrees centigrade per decade, whereas other ocean is only 0.1. So this makes it our ocean much more vulnerable in terms of productivity and all. And within Indian Ocean, if you see, Western Indian Ocean is warming at a significantly rapid rate. And it has been shown now very clearly that warming is increasing the stratification, and because of that, productivity of the entire ocean is going down. So this study you can see, which has been published in 2006, clearly established that when you have a higher temperature, means sea surface temperature is increasing, the stratification is increasing, and productivity is decreasing. And if you focus here in terms of in the Indian Ocean, particularly this region, you can see the model study shows that in part of that the productivity is increasing, and part of the Indian Ocean productivity is decreasing. But more detailed work which has been done recently, it clearly shows that at least last several years, productivity is decreasing. This green color shows the productivity is going down and temperature is increasing. So clearly shows that almost last 20 years or 30 years, productivity has gone down by about 20% or 30%. So if you can see if productivity is going down, it has different repercussions in terms of CO2 uptake and all those things, and also in terms of chemistry or biogeochemistry of the ocean. So till now, only this stratification has been looked into, but in addition to stratification, because of this warming, other things are also happening in terms of El Nino or INSO. If you see the water which is coming from Pacific, it is coming more. And because of that, what is happening, thermocline means, again, it is helping to put the thermocline in the Western Indian Ocean very deeper, and because of that, productivity is going down in the Western Indian Ocean. So this is another aspect of that which shows that the INSO is also, which is means with global warming, INSO is increasing, and that is decreasing the productivity in Indian Ocean, and that is impacting the fisheries. So you can see here, it is very clearly shown in the 15-16 year, which is the El Nino year. The fisheries, the productivity as a whole has gone down, and in particular in Kerala coast and other places, all sardine population has gone down, and you can see the catch in that area has gone down. So you can see very clearly that global warming and Indian Ocean warming is directly impacting the fishery. Fishery is decreasing, and in long run, it will be having a lot of impact on that. So we need to look into that. Another very important aspect of this productivity change is change in phytoplankton community. The species or productivity type is changing. You can see here very clearly that earlier the cyanobacteria population in the water column was very, very less, but now it is increasing. And many places now the cyanobacteria, earlier which was dominated by diatoms and flagellates, now it is getting dominated by phytoplankton. This phycoplankton, that is cyanobacteria. And the cyanobacteria, because of its size and all, they are more efficient to extract the nutrients. Even in the stratified condition, low nutrient condition, they are thriving, and almost they are in some of the area, they are becoming as high as 40 to 50%. So the whole community shift is taking place, and that will again impact the productivity and fisheries in this area. And this community shift is also seen recently. You can see now we are able to see this deeper productive area, high chlorophyll area, and these are represented by this cyanobacteria, which is they call it Prochlorococcus and Cyanococcus. So these are having very different kind of requirement of micronutrients and nutrients, and because of that, you can see, I wanted to show you that the cyanobacteria, which has been studied, which was existing 800 million back, the requirement of metal was very different in terms of zinc. Here you can see zinc requirement was very, very high for prokaryotes compared to eukaryotes. Exactly now the same is happening in the Indian Ocean. When we try to see this micronutrient distribution in Indian Ocean since last 30 years, we have some data 30 years back, and today if you compare, you can see the zinc distribution. 86 it was much higher, now it is going down significantly. So it is two stations we have seen, because the zinc requirement for the cyanobacteria is less compared to the diatom. So since diatom is going down, this is going down. And also nickel, which is being utilized as in the many of these elements. You can see here nickel requirement for the cyanobacteria is more, so it is increasing. So whole chemistry is changing. So you can see the not only productivity has changed, but also it is changing the type of the productivity or type of the biology is changing, and because of that chemistry is changing. So a lot need had to be done. So there is a need to develop and sustain a long-term physical and biological observation to assess and investigate the response of physical, geochemical and biological components of the Indian Ocean to climate change through both observation and modeling in this direction, which we are trying to do. The entire CSIR means the labs which are dealing with the oceanography, they are trying to do. And finally, how it will be impacting the this productivity and fisheries, it has to be looked into. Thank you very much.
Thank you, Dr. Singh, in sticking to time. I think now we will take some questions for all three speakers. I think first question, Dr. Salvamurthy, is for Kanan, I guess. What are the CSIR endeavor for application of nanomaterial like nanosilver for taking care of microbial contamination in water, or nano sponges for reducing industrial effluent reaching water bodies?
Yeah, actually, I mean, there is a kind of a different view of using isolated nanomaterials for water treatment because of the leaching issues. So per se, I mean, anything which is basically on a kind of a fixed on a certain matrix where leachability is not a concern, we can use. But if it is kind of isolated nanomaterials, I mean, we do not advocate unless otherwise the efficacy in terms of leaching and associated toxicity effects are completely understood as far as water treatments are concerned.
I think second question is also for you by Dr. Surya Raghu, ETQ International. How does CSR plan to transition to a market this very useful technology for scale up?
Yeah, I mean, that's a very interesting question. I've been thinking for the last 1 hour on this particular question. Okay, once it is posted on the chat box, it's not an easy question. There is, I mean, at the national level, I mean, we are basically advocating through policies, and we are basically advocating through entrepreneurs in translating the technology. But for taking it into a kind of a larger scale, I mean, I think larger platforms, maybe, I mean, United Nations kind of a platforms could be a kind of a way by which the translation of technology can, or at least the proliferation of the technology can happen on a, what do you call, a multinational scale. At the national scales, entrepreneurs and industries, we are basically going ahead with them. But as far as the wider proliferation, I think I do not have a kind of a direct answer for that.
Yeah. And of course, there is a hint again from Juliet for globalizing these technologies. I think that's loud and clear. And then there is any collaboration with Israel, which is also water stress and technologically advanced. Any technology that could be applicable to India. So I will request you and Dr. Rama, because Dr. Rama is doing a lot of partnering with Israeli companies. So both of you will have to answer this question.
I would
first you and then Dr. Rama.
I would say first to Rama to start rather than me.
Okay, Dr. Rama, you take it.
Thank you, sir. Thank you, sir. We do have collaborations going on, discussions going on with Israel, with many of the research institutions, universities, as also the industry. But so far, water technologies are not being discussed. But we'll